My name is Frank Aibogun. I'm the publisher of Business Day, and I'm delighted to welcome all.
Hello, welcome to Culture Code. Today we're going to be going in there to meet with the director of the first private museum in Nigeria. This is the Yemisi Shillong Museum of Art in the Pan-Atlantic University in Ibejuleki. We'll be meeting with the director, Jessica Sayote, who's also the architect of this building. He'll be telling us about the ambition of the museum and what they have in store for the 19th of October in a month's time. Come with me. So, how did it all start, Jess?
For years, we were talking with several collectors about the possibility of setting up a museum at the university. And eventually, a few years back, we agreed with Prince Shillong, and he generously donated or agreed to donate over 1,000 works from his huge collection. Then he also agreed to provide money for the building, and then we started planning what type of museum, what do we want to achieve, why a museum, what is the model we are going to follow, how are museums in universities.
My name is Frank Aibogun. I'm the publisher of Business Day, and I'm delighted to welcome all our guests from Nigeria and around the world to this very important national conversation. We're encouraged by the thousands of people that have registered to join this event from around the world, from as far as India, Singapore, and Europe, as well as the United States of America. It is both a testimony of the times in which we live, as there is no better time to have a conversation about the uncertain future we all face, and the array of speakers that we have assembled to speak to you over the next 2 days. The last few months have truly been the most unsettling and troubling for individuals, small and large businesses alike, as well as for nations. Nigeria is no exception. In the immediate days and weeks after the sudden closure of economies around the world, we have had some conversations to understand the nature of the shock from COVID-19 and the pandemic that it has caused, and how this was going to shape businesses both domestically and globally, and especially how Nigeria should respond. Those events were very helpful in sharing the first set of ideas and knowledge of the crisis and how it affects businesses and how Nigeria was responded. Although this is still unraveling, there is now one thing that is clear to all of us. While the pandemic is universal, the management of it has not been uniform across nations, and surely the outcomes have not been the same. Nonetheless, many countries share in the devastating scale and severity of economic and business disruption never once imagined or seen. It is therefore time to share a deeper knowledge of where we are in relation to the management of COVID-19 pandemic in Nigeria and Africa, how it is shaping and driving business, social and economic conditions in the country, and what the future holds in terms of jobs, poverty, economic growth, inequality, and of course Nigeria's economic prosperity. Over the next 2 days, you will be hearing from an array of thought leaders and policymakers during this groundbreaking conversation around the management of COVID-19 and its trajectories in Nigeria, and the features and properties of the pandemic shock we still don't know. However, the discussions will not only cover the trajectory of the COVID-19 pandemic and the parameters shaping it, but also how this is affecting the different sections of the Nigerian economy. In addition, because we recognize that the impact is also dependent on the pre-COVID-19 conditions, we have assembled speakers to provide historical context to what we currently face in our country. Today and tomorrow, you will thus hear how the Nigerian government, its agencies, and its people are responding to this most unprecedented, severe economic crisis following COVID-19 and the constraints that they face in that response. We will be focusing on the intersection of governance and economic development, as well as celebrating some of our successes as a nation. And in this regard, we have a session devoted to examining how we succeeded with Ebola, the contributory pension scheme, the liquefied natural gas project, the cement, and the telecoms revolution that have helped to reposition the economy of Nigeria. Our hope is that our leaders can be inspired to replicate these successes in other areas where Nigeria continues to struggle today. I hope this will help you all in decisions about your life and your business or investment, but perhaps also about your future. Finally, before I hand over to the moderator for the first panel today, permit me to thank our generous partners for this event. We thank most especially the Nigerian Incentive-Based Risk Sharing System for Agricultural Lending, NISAL, the Central Securities Clearing System, First Bank Nigeria Holdings, Union Bank PLC, FMDQ, Hadiel, Jobberman Nigeria Natural Resource, and Upfield for their support in staging this conversation. As I hand over to the moderator, please let us have your views. Be free to ask your questions of our panels, and let us join in this very important conversation by also taking part in the several pools that we'll be conducting in the course of the next 2 days. In the first panel titled COVID-19, How Nigeria is Fighting the War, we will have Professor Akin Abayomi, the Commissioner for Health for Lagos State, Funke Adeyemi, African Regional Director for the International Air Transport Association, IATA, Professor Christy Happy, Director, African Center for Excellence for Genomics Infections at Redeemers University, Professor Maurice Iwu, Chairman, Bio-Resource Development and Conservation Program, Fola Laoye, Founder and CEO, Health Markets Africa, as well as Professor Abubakar Sadiki Mohammed, Vice Chairman of the ANAP Foundation's COVID-19 Task Team. Let me now take the absolute delight in handing over to our moderator for this first session, Dr. Chini Ogunro, CEO of Wellspring Health. I thank you all very much. Dr. Ogunro.
We do allow comments, and we very much welcome comments and questions via the Slido platform. So if you would want to make questions or comments, please visit www.slido.com, put in the hashtag BDANC2020, and we'll very much welcome your questions and comments. For this panel, we all know that the country is right in the middle of the management of the COVID-19 pandemic. Now, while the trajectory of the pandemic will continue to be shaped by contact tracing, testing, and the overall management of those infected, it is clear that Nigeria and many other countries are confronted by a scale and severity of business and economic disruption, though it is still unraveling, which has never been seen before. This session seeks to set the stage for the economic, political, and social analysis that will follow over the next 2 days. Our current panelists will use their medical and health background to provide an update on where we are in the management of COVID-19 in Nigeria and in Africa, to give you some insights on how we deal with issues around the trajectory of Nigeria and Africa's numbers, and to provide an understanding of its peculiarities in relation to pre-COVID healthcare systems. And lastly, we seek to map the end of the pandemic in Nigeria and Africa and have a brief discussion around what the future might look like. So let's meet our panelists. I'm honored to be joined today by the Honorable Commissioner for Health of Lagos State, Professor Emmanuel Akinola Abayomi. I'm also being joined by Kunle Oyelana, the Managing Director of GlaxoSmithKline Nigeria. We also have with us today Professor Christian Happy, the Director of the African Center of Excellence for Genomics of Infectious Diseases at Redeemers University. Also joining us is Fola Laoye, Founder and CEO of Health Markets Africa. Professor Maurice M. Iwu is also joining us, and he's the President of the Bioresources Development Group. We're also joined by Adefunke Adeyemi, the Regional Director of the Africa International Air Transport Association. And last, but certainly not least, is Professor Abubakar Sadiq Mohammed, the Vice Chair of ANAP Foundation COVID-19 think tank. Welcome to all of our panelists, and I look forward to having a sprightly discussion. Now, I've previously laid the groundwork and essentially said the background of what it is that we are going to be discussing today. My very first question is to you, Honorable Commissioner for Health. Where are we in the management of COVID-19 in Nigeria and Africa? We're seeking for you to provide an update on the infections, the contact tracing, the testing, because at this point in time, a number of everyday Nigerians are a bit confused. We see the number of cases increasing, but we also see that lockdown measures have been eased. So if you are speaking directly to the people, how can you explain where we are in terms of how we are managing COVID-19 right now?
Right, thank you very much. So let me just start from a higher philosophical level. When you're managing a public health threat, so we normally as government look at what we call the tripod of biosecurity threats. And that includes the public health crisis itself, and that may tip you into an economic crisis. And then where you have the public health crisis and an economic crisis lined up side by side, then you have the third leg of the tripod, which is security or breakdown in law and order. So the job of government is always to find that, that happy medium between the three legs of stability during a public health threat. So there's the one hand, we're trying to manage the public health crisis. And then on the other hand, we're trying to avert an economic crisis and a social or security crisis that will compound the issue. So I guess the discussion revolves around the issue of lockdown. And you have to balance the science of the outbreak with the policies of government. So we now see that the outbreak can you hear me? Hello?
We can hear you.
Can you hear me?
Yes.
Yes, sir, we're able
to. Commissioner, we can hear you.
Yes. So we now see that the profile of the outbreak in Lagos for sure, and it's difficult for me to get an exact grip on what's going on in the rest of Nigeria. But our data, and Lagos is driving a heavy data-informed outbreak response. Our data suggests that we have a slightly different profile from the disease that we saw in the Northern Hemisphere. So we have a majority of our patients who contract the virus. I would say between 60 and 70% of them have what we describe as asymptomatic to mild disease. In fact, this profile is what's driving the community transmission because you may have the virus and you don't even know that you have it. And then a smaller proportion, say about 20 to 30%, have what we call or describe as a moderate disease. So they're just unwell for a few days, but they will recover no matter what you do. Where we have concern now is with the patients that are in a sort of a 5% bracket who have severe to critical disease. And the profile of such patients is usually they're above the age of 50. They have some underlying conditions, typically what we describe as the metabolic syndrome, hypertension, diabetes, or obesity. So now that we've understood a little bit more about the science of COVID-19 in Lagos, we've tried to modify our policies and our strategies to suit. It's important now that we address the rescue of patients with severe to critical disease, while at the same time trying to ensure that we slow down the transmission of the virus in community. So if you remember, we started off this game as a sprint. We were trying to identify every single patient, do the contact tracing, lockdown, identify all contacts, test them, move them to isolation centers. We were building as many isolation centers as we could. And we were slowing down the economy to implement the attributes of social distancing. If we were not careful, we would have tipped Lagos into an economic crisis. And that economic crisis plus the public health crisis would have led to insecurity and breakdown in law and order. So the government has to slow down on or somehow review and revise the lockdown strategy in Lagos, combining the statistics that we're seeing with the disease profile in this environment, just to make sure that we allow the economy to take over slowly while ensuring that it has elements of social distancing within the way in which we're allowing the economy to build itself back up. So the issue of handouts and palliatives is a very expensive activity, trying to shut everybody in their homes in an economy that most people are in the informal sector and depend on a day-to-day livelihood. That was going to turn out to be an extremely expensive endeavor on the part of government. And so it was important that we balance the science of the outbreak, the demographic profile, and we think that the reason why we're seeing mild to moderate disease or even asymptomatic to mild as the predominant clinical feature is because of the demographic profile of the population of Lagos. So we generally tend to have a youth bulge. Most of the people in Lagos are under the age of 30, whereas most of the people in the Northern Hemisphere are over the age of 50. And we know that this virus has a predilection for people over the age of 50. And so that may explain why we're seeing this kind of profile in Lagos. So to come back to your question, the whole issue about lockdown, it's a government's responsibility to ensure that the tripod of a biosecurity threat is maintained. While we're trying to manage the public health crisis, we're at the same time trying to manage an economic prevents the state from going into an economic crisis, which will inevitably lead to a breakdown of law and order and social unrest. So that's where we are right now in Lagos. Thank you.
Thank you so much, sir, for your inputs. And I think we can all certainly understand the need to balance the potential social unrest with moving the economy forward and simultaneously ensuring that the general population remains safe, remains quite healthy. I'm going to move on to, let's say, the future. A potential, let's say, vaccine has come about. My question is now directed at Mr. Oyelana, the Managing Director of GSK Nigeria. What is the status of the development of a COVID-19 vaccine? We've heard different companies all over the world who speak about hitting various stages of clinical trials, but we've also heard that it may take a minimum of 18 months to have anything tangible for the general population. So what is the pharmaceutical industry actually doing to ensure that both the development of a vaccine as well as equitable distribution of a potential COVID-19 vaccine are in our view?
Thank you very much, Jenny. And let me thank the organizers, Business Day, for setting up this session. It offers an excellent opportunity for all of us to reflect on the management of this very disruptive and unique pandemic. I must also condole families that have lost loved ones to this, while paying kudos to frontline healthcare workers and everyone else that's been involved in making sure that medicines are available during this pandemic, which, as the Honorable Commissioner said, has disrupted lives and on the verge of also disrupting livelihoods. Specifically to the point of what the pharmaceutical industry is doing on a general level, it's important to note that against the backdrop of the gloom from this pandemic, our response as a nation has been largely encouraging. And there are some bright spots, especially in some of our states, regarding how this has been managed. Again, a lot of resilience has been shown by the pharmaceutical industry from the perspective of both the global and local response and management of the crisis. One of the things that has happened so far, specifically in Nigeria, is that the industry has ensured a robust supply chain by prioritizing actions to deliver medicines that are used in the management of COVID-19. My organization, GSK, of course, is inclusive of those organizations that have prioritized that essentially. And of course, a number of these organizations, pharma industry, have also supported healthcare professionals with education and information regarding COVID-19. And I'm aware also that organizations like mine have also made donations of PPE to protect frontline healthcare workers. To your point on the vaccines, what is happening regarding the vaccine timeframe? It's been said that COVID-19 is going to be with us, as it were, for quite some time. It's not going to go away as quickly as it come. And one of the things that will enable the full reopening of all economies, Nigeria inclusive, will be the availability of a vaccine that will enable everywhere to open and get back to a semblance of as much normalcy as possible. In the industry generally, and us specifically, we are using our science, our portfolio, and our resources to support the development of not just vaccines actually, but generally products that are going to be used and useful in the management of COVID. One of the things we're doing specifically is that we're combining our innovative technology to develop what we call an adjuvanted COVID-19 vaccine, which will enter clinical trial in the second half of this year, which is in a few days' time. I'm aware that quite a number of candidate vaccines really that are in development in terms of research and development, in terms of research and also development. The vaccines that we're working on together with our partner, another multinational firm, if this vaccine is successful from the R&D phase, and of course subject to regulatory considerations, we aim to complete the development and have availability in 2021, possibly in the second half of 2021. I must say that it's a huge endeavor, and probably this will be the fastest timeline to get any vaccine available that we've ever seen in the world. And it's a testament to the collaboration that's going on between multinational firms, innovative firms like ours, and of course, research institutions and agencies all over the world. You mentioned in terms of our availability, how available would this vaccine be? For us on our part as GSK, we've confirmed our intention to manufacture at least 1 billion doses of the pandemic vaccine adjuvant system that can be combined with vaccines from a number of manufacturers. So what we're still doing is to support multiple developments of many candidate vaccines. And again, this will help us to expedite the availability of vaccines all over the world, again, still within the timeframe of 2021. And in addition to that, also, we've examined our global supply chain to make sure that the capacity exists and is scaled up. That at the point where the vaccine will be available, we will be able to make sure that it's available to everybody. On equitable distribution that you mentioned, the WHO is committed to equitable distribution of any candidate vaccine, COVID vaccine that will be available in any time frame. And it's important to note that Gavi is an association called the Global Alliance for Vaccines and Immunization, which is currently chaired by our own Dr. Ngozi Okonjo-Iweala, has just recently successfully replenished to the tune of about 8.8 billion, really. And this financing system and mechanism for vaccines that will be delivered across all nations.
Thank you so much for that insight. And I think everybody can breathe a small sigh of relief and have the understanding that at the very least, we have some insights into when we may have a potential vaccine. I'm going to move on to Mrs. Fola Laoye from Health Markets Africa, because I want to touch a bit on what the Honorable Commissioner mentioned about in the beginning. We all remember that in Lagos State, at least, the government was definitely trying to have much of the control in terms of oversight, in terms of treatment, in terms of testing for COVID-19. But now that so many cases have come up and now that so many people will need or potentially need treatment, we've seen the private sector move in. Many people have the misconception that only governments, public institutions, and faith-based organizations have played key roles in Nigeria's COVID-19 response. However, several impactful initiatives and efforts have come from the private sector, and more specifically, the private health sector. So, Mrs. Laoye, can you provide us with some insights on what the private sector has been doing so far? And more interestingly, if you've seen examples of innovation around testing and treatment, or innovation around how people are kept during this period, we'd certainly love to hear that.
Great, thanks, Ginny. And let me first start by saying kudos and thank you to Frank and the team at Business Day for putting this set of dialogues together. Yeah, I think, again, just to start with, perhaps to sort of, again, really acknowledge and appreciate, what the Honorable Commissioner said in his opening statement, and also in what we know to have been and is still a very active planning and and well thought out strategy in Lagos State, which really is a roadmap that's led by the incident commander, Mr. Governor himself, and of course, orchestrated by the commissioner to really cover, the issues of tracing, testing, isolating, and treatment for COVID. I think the fact that platform, has been very well thought through and laid out has, as you say, Chini, made it possible, shall I say, for private sector collaboration to come in. I mean, yes, certainly we know that private sector has had many roles to play in healthcare anyway in Nigeria, largely so from what I'll call the sort of expenditure side. So we know that private citizens do spend a significant amount of their own out-of-pocket resources on health. But of course, that always sort of brings it very much into the domain that, health is a public good. It's a good that is required by everyone. The need is there. And certainly when, COVID came calling, I guess we realized in the private sector that, whatever we could do to bring resources to the table to really sort of join forces with government was going to be important. So I'll speak on two fronts. I'll speak first about what I'll call the sort of more large private sector response, which has been more in terms of saying, how can we join forces with government? And then I'll spend a little bit of time also on the private health sector itself. On the sort of larger private, sector response, I think this has been an opportunity again to think about how do we marshal our resources, which we know we have, not just in terms of capital, but in terms of expertise, and supply chain and so on, and bring them to the table. We've seen several different organizations or coalitions come together. I guess the biggest and probably the most well-known is the Central Bank or the Bankers Committee-led CACOVID, which has really come strongly together to support governments all over the country in terms of advocacy, as well as actually putting infrastructure on the table. There have been other organizations as well, like the Faith Foundation, which has also done its own part. ANAP Foundation, I guess we'll hear from them as well, who have also all come in very strongly. I'll probably speak more, shall I say, from a personal experience of being a co-chair of an organization called the Young Presidents Organization, YPO, which is a group again of business leaders, both business owners as well as corporate CEOs, who again sort of saw the reasoning, shall I say, of really coming together and bringing resources together for this. And what we did really was approaching the Lagos State government, who have been very open and and very much welcoming all these different efforts, and helping to put up an isolation and treatment center, the Etiosa Isolation Center, the landmark. And we really were able to bring all these resources together in just 21 days to have a center up and running that has just over 80 beds and has some capacity as well for looking after the more moderate to severe cases, as the commissioner put it. I mean, obviously it was a testament to a real community effort of seeing the private sector, bring capital, bring equipment, bring infrastructure, bring people, staff, volunteers, and so on together, and really sort of create a system that was not just, shall I say, coupled together, but one that could actually start operations and start looking after patients sort of almost from day one. And I think that sort of collaborative effort, including even the drug companies and so on, has been pretty special and pretty important at a time like this. So I think I've hopefully given you a picture of the way in which, as I said, the private sector has really been able to come hand in hand and work with government, on that front. But perhaps I should also talk a bit, as I said, of the private health sector, which again is not insignificant. In Lagos, the private health sector is almost 50% really of what I'll call the delivery as well of health services. And that cuts across pharmacy networks, which are, of course, tend to be the first port of call. And I have to say that the fact that pharmacy networks have worked tirelessly, even during the lockdown period, to stay open, to make sure that the supply chains have been in place and unbroken. And even a lot of them have pivoted to even be able to deliver drugs and essential medicines and goods, to the population at home, has been very important. In addition to that, of course, we're seeing now private labs and private hospitals who are really gearing themselves ready, as you said, Chini, to really be able to sort of give much needed extra capacity as we're thinking about the numbers sort of rising. But some of the things that that has happened, and particularly in the case of the more severe cases, is we've seen some of the sort of strong skills that are in the private sector. For instance, the team at First Cardiology, who have really been able to work hand in hand with Lagos State, with the Yaba IDH, with Etiosa as well, to really put together, shall I say, a critical care and high care, service, going through this pandemic. But again, as we go forward, I mean, we've seen the fact that, as you mentioned, innovation has been incredible. From the ideas of telemedicine and telehealth, and the use of telemedicine and telehealth, which has always sort of been with us, but I think has really come into its own. You've seen hospitals who've been able to maintain, again, their service delivery by moving into video consultations with patients and ensure that the more routine care for health, doesn't stop just because, the population has found it difficult to get into hospitals. We've seen the fact that from a point of view of testing, the whole concept around drive-through testing, as well as sort of mobile testing booths, where a lot of thought has gone into how to reduce the use of PPP, at the same time reducing, person-to-person contact, has really, given birth to, again, increasing the ability to test on a wide scale, while sort of being conscious of, being, cost effective. And then, of course, we've seen community tools, COVID triage tools, even a strong PPP with Lagos State called the Eco Telehealth System, which now is a mobile app that can be used to triage patients, to triage the population who are not necessarily patients, but just to understand, what their level of risk for COVID is, but at the same time also be able to access their health, their Lagos State health insurance scheme and, other parts of the health system. And then, of course, there's a lot of beta testing going on around, rapid test kits, artificial intelligence around reading X-rays, and so on. So I think this last quarter, this last 3 months, has really sort of challenged the health system, especially the private health system, to think about innovation. Thanks.
Thank you so much for that wonderful response. I love the idea of innovation. I love the new technologies that are coming on board, because we're all very aware that this COVID-19 pandemic is essentially forcing businesses and countries to move into technologies at an accelerated rate than they otherwise would have. The fact that we're doing this on the Zoom platform and that we're having this teleconference itself is indicative of that. The Eco Telehealth system, the increase in telemedicine, those sorts of things, I think are true advancements and sort of the silver lining around this entire pandemic situation. Part of what you mentioned, Fala, was how we are moving forward with isolation centers. The private sector is helping to move forward with treatment. But one of my questions, and this to you, Professor Happy, is really around the genomics perspective. We've heard from different parts of the world, since this virus is happening asynchronously. It's happened in China before it started happening in Europe, before it started happening in the US. So we've been able to look at China, for example, to kind of see what might take place in other parts of the world. We hear of reinfection in some Asian countries. We hear of potentially different blood types being affected differently. And we initially, many Africans were saying that because of our own susceptibility to infectious diseases, we're less susceptible, that we're less susceptible to COVID-19 because we've had, malaria, we've had Ebola, and that's for these reasons, potentially at a genetic level, we're less likely to be so hard hit from COVID-19. So Professor Happy, can you please give us your perspective? Do we really understand the behavior of this virus in Nigeria and in Africa? And does our environment does it make any difference, positively or negatively, toward the manner in which the virus actually impacts us? And I'm going to ask everyone if we can please make the comments a bit more brief. In that way, we'll be able to take questions from the audience, and we'll have much more of a conversation between ourselves, the panelists, and the audience. So Professor Happy, please, your perspective on the genomics and how it affects us. Okay, so he may be in a bit of he may be a bit unawares. of this right now. So we'll wait for him to join the session once again. But I'll also actually pose the same question to you, Professor Iwu. From your position as president of the Bioresources Development Group, in the absence of widespread testing, what do you estimate what is the estimate of those who have the virus without knowing? The Honorable Commissioner mentioned a bit of the statistics, a few of the statistics around those who are asymptomatic and able to pass on the degrees or spread the degrees to others. So can you please elaborate a bit on where we are with testing, the importance of testing, and how what the estimate of those who may have the virus without knowing actually be?
Sorry, I was actually on mute. Yeah,
Nope.
as I speak again, I was going to say that my main interest actually is what happens after now. One of the issues that has happened is well and good to test us and find out those who are positive and those who are negative. Apart from what those that the Honorable Commissioner did mention, the very small percentage that are actually sick. What do we do with the rest of the population? I think one of the things that has happened that it has exposed our underbelly, namely that we are in a big country with a large pharmaceutical industry, but we do not manufacture any single active pharmaceutical ingredient, not one. All of our products are imported. And that was what really gets my group bothered, that we do not make our own drugs. So that if this global lockdown had continued for a while, it would have been impossible for us to get basic necessities that we need for the healthcare. So if you like, I can actually share my screen with you and be able to point out a few things that we are doing. Can I do that?
Yes, please.
Can you hear me?
Yes, we can hear you, but I'm not sure that panelists have screen sharing capabilities.
Okay,
so if you'd be able to talk us through what you were going to otherwise share, that would be great.
Okay, so what I was actually trying to say here is that the fact that we have a situation in our hands that where we cannot make any single drug on our own, so that if the lockdown has actually happened much longer, we could have been in a very bad shape. So what is actually happening now is the fact that we are able to look at at what we have and been able to see whether we can. Hello, can you hear me?
Yes, we can hear you.
Okay, so what I was actually saying in effect that we can have a situation that this has actually changed the entire pharmaceutical industry, namely that after COVID-19, we'll be able to make our own APIs. What we did was to go back in 2014, 2015, based on what happened during the Ebola crisis. We tested a whole lot of Nigerian compounds. Compounds, I'm not talking about herbs, I'm talking about isolated pure compounds that we got from nature. And we tested them against SARS coronavirus. And what then happened was that 3 of them were active. And we went ahead to patent them at that time. One of the biggest problems that is happening, that most people think that coronavirus is entirely a new virus. It isn't. It is SARS-CoV-2. It is a second coming of a very well-known virus. And what has actually happened now was that if you look at how the curves of coronavirus happens, most viruses, this is the second leg of a W curve. It happened earlier. The Chinese managed this very well. And what we did in effect was to take one of the plans that they had worked on at that time, which have subjected to clinical trials. And they have tested them 33 times. And then we are learning from what has happened, and we're able to now subject this particular compound to test with the help of the United States Institute of Health. And we are lucky that the compounds were active, and we then subjected them to further tests. The computerized docking showed that the compound can successfully dock with SARS-CoV-2, which makes it possible for us for the first time to have an API manufactured and produced in Nigeria. Currently, while we are waiting for the clinical trials to commence and finish, we have a product which we call IHP Detox Tea, which is already in the market, and people are using it for both prophylactic use and for treatment purposes. So my own taking that post COVID-19, that the entire pharmaceutical industry have to change. We have to actually embrace the fact that we do not have to rely on others for our own medical needs. Without in-house, in-country synthesis of active pharmaceutical ingredients, we are so vulnerable that even if we do all the tests in the world and we do not have a means of taking care of ourselves, that we are very vulnerable. Luckily, there is an inward thinking now that most people have realized that we need we need not only to test more, we also need to develop compounds that are Nigerian and that are actually our own. And that's actually what we are doing. Thank you.
Thank you so much for that informative bit around how we might be able to have our own vaccine later on. I'm going to pause for a second and let the audience know to please go to the slide code, put in the slide code BDANC 2020 at the right side of your screen in order to participate in the ongoing polls. Again, that is BD as in dog, B as in boy, D as in dog, ANC 2020 at the right side of your screens in order to participate in the ongoing polls. Thank you all so much. So the last few questions I have before we open it up to the audience, I want to make this more conversational, and I'm actually going to use a few of the questions that the audience members have already asked. And I'm going to first send this question in your direction, Mrs. Adeyemi, as the Africa International Air Transport at the Africa International Air Transport Association. I'd like to have an idea of what did the lockdown actually achieve its aim in terms of slowing the transmission of the disease? And that is a question directly from the audience. We know that interstate and air travel are expected to resume in the coming weeks. So will this reopening, will it increase the number of infections? And what have you seen in your position? And in your response, I ask you to please keep your response to maybe 2, 3, maximum 4 minutes in order for us to ask another question to the rest of the panelists from the audience.
All right, thank you very much. And let me start by commending Business Day for organizing these conversations, very insightful. And I'd also like to commend our healthcare heroes all on this call, the commissioner and all the other stakeholders for the grateful work that they're doing. I think we all know by now that aviation, one of the hardest hit sectors from the COVID. And over the past 3 months, passenger travel reduced by 95%. That led to a loss of GDP for Africa of about $28.5 billion and put about 3 million jobs at risk. So this is major. And for Nigeria, I mean, the loss was less colossal. For the industry, had about $700 million loss and about 90,000 jobs at risk across the entire value chain of aviation. So this was economic impact. From a healthcare perspective, of course, governments closed down their borders as a result of trying to reduce the transmission of COVID. And this is something that the governor had mentioned before. But without aviation still being able to move around, the fight against COVID would have been a lot worse than what we've seen, because even though passenger travel was down, was non-existent, the mission was still supporting the fight with COVID by ferrying medicines and essential provisions around the continent, and also for Africa as well, for Nigeria, I beg your pardon. So aviation continues to maintain its criticality. It's not just, a means of transportation, but it's actually an economic catalyst and also supports our care fight against COVID. So just bearing all of that in mind, to go to the issue and to speak to what's happening now. All of this while governments have been shut, the industry has been working to proactively see how we can try to mitigate the risk of spread, where aviation is as a vector for spreading, at the same time maintaining the comfort of both governments and passengers' travel. And I think it was Kule that mentioned that COVID is with us for some time. And so with that said, there isn't one single, bullet solution. Actually, what we've come up with now under the United Nations aviation body, ICAO, and ATA, which is the business or commercial side of aviation, we've jointly come up with a series of biosecurity measures, temporary measures that will look at the entire end-to-end passenger journey, right from pre-flight, where we can collect advanced passenger data and health declarations through established platforms, to the travel procedure at the airport, temperature checks, making sure that there's physical distancing at different boarding and check-in and security and all of the critical touch points of a passenger journey. In flight, which is that is quite interesting, and a lot of people are interested in that, you do in flight. And really thing that we found is face coverings help mitigate the risk in flight, and as well as the cabin environment of the filtration system on an aircraft is similar to what you will find in a high-end theater, a surgical theater in a hospital. So it's one of the safest confined spaces that you can find there. And so the point is that while it will never be 100% safe to travel any form of transportation, the aviation industry has put in place all of these measures to ensure that it will be as safe as possible to restart. And of course, when you get to the other side as well, when you arrive, those measures are also in place to ensure that these issues don't proliferate to the country that you're going to. And so the things that those governments do would be contact tracing, of course, and health declaration. So these are mutually recognized international measures that all governments are going to use. I hope that that addresses the issue as the question. Thank you.
Yes, very much so. And thank you so much for your answer. I think for a number of people in the audience who may be frequent travelers or consultants, people who have to move either from state to state or country to country frequently, we look at the flights, or a few of the flights that are taking place in the US or in Europe, and they are packed like sardines. And it's always with a bit of trepidation that you ask yourself, if I get on a flight now, will I actually be safe? So I thank you so much for that
Thank
answer.
you. Can I just chip in one last thing? We just had a University of Edinburgh just released a study on the use of face masks and found that it reduces the forward trajectory of exhaled breath and the droplets come with it, or coughing or sneezing or anything that, exhaling through the mouth, by 90%. So please wear your masks. Thank you.
Thank you so much. So I'm going to have Professor Mohammed, please, of the Vice Chair of AMPA Foundation for COVID-19. This last question for me, at least, before we open it up to the audience, is simply around a few weeks ago, I held a seminar, I moderated a seminar, and one of the polling questions asked, who does the audience feel has done better at providing palliatives for the general population, either the government or faith-based organizations or not-for-profit foundations. And interestingly enough, the lowest percentage for that received who has done the best was the government. So from your perspective, what are foundations doing? Since the public feels that foundations and not-for-profits are doing such a great job in their COVID response, I'd like to hear from you directly. What is it that you're doing, and what do you feel can be done better? Or alternatively, what might the government be able to learn from foundations? And to reiterate, that question is to you, Professor Abubakar. Okay, so he may be having a few technical difficulties, and we'll just move right into the questions from the audience. And this is out to the general panel, to everybody in the panel. Maybe we'll start with the one based on the Honorable Commissioner's lecture. So the question says, based on the Commissioner's lecture with last G, can we please review the categories of patients admitted to isolation centers for mainly the 5 to 10% of patients with severe COVID-19? I think the crux of the question is really about, will the state governments be reviewing what type of patients will actually have to go to isolation center, as opposed to anybody who tested positively that had to go to the isolation centers?
Okay, is that question for me?
Yes, please.
Okay. So the underlying principle of managing COVID is basically test and isolate to retard the opportunity for the virus to be transmitted from one person to another. So in this case, when we find that majority of our patients or the people that we're testing fall within the category of asymptomatic to mild, if we start finding thousands and thousands or even millions of people who are positive, but yet do not have significant clinical features and are not in any perceived danger of deteriorating or ending up as a critical case, then we've had to review our policies. We still need to isolate, but the question is where. So we've adopted what the WHO has recommended in countries where there is an expanding transmission, community transmission, and we are in the process of refining our isolation strategy to shift to incorporate and integrate what we call the community or home-based care. So in home-based care, we assess your house or your environment as suitable for isolation if you are asymptomatic or mild. And then we reserve our more central isolation facilities, of which we have between 6 and 10. And we're hoping to go up to about 1,000 beds in the next couple of weeks. We reserve those for patients that need closer monitoring and closer medical attention, and of course, those that need oxygen therapy, which is unsuitable to deliver in the home setting. So that's how we're triaging our patients in Lagos State. We haven't commenced home-based care yet. We're in the process of doing that. It requires a little bit of logistics to put in place to identify and to visit people's homes, identify what is suitable and what is not suitable, and then allow people to manage themselves at home with supervision. You heard about the adoption of modern technology. We're using call center, we're using eco-telemed or telemedicine. Feeling unwell. And then if some private sector family medicine practitioners want to participate in home-based care, all sectors of the healthcare industry in Lagos are invited to participate. Just because it's a public health crisis, it needs to be regulated, and it's regulated at several levels. It's regulated at sample level, it's regulated at data level, it's regulated at infrastructure level, and it's regulated at human resource level. Just to make sure that we are in complete control of the situation. We know where all patients are at all times. We know where all samples are at all times, and that the data of Lagosians is safe in the hands of government. It's very important that the government of Lagos State is able to ensure that the data and the sample of its citizens and the information generated by the outbreak response is managed in a safe way and in an environment that gives Lagosians the confidence that the government is not going to allow their data or their information to be made available without the appropriate requisite governance. And that all revolves around what we describe as informed consent. So Lagosians, your data and your samples and all your personal information is around COVID-19 is kept in an extremely safe environment for the use of government in terms of defining how we move ahead and defining policies for the community and for the state. Thank you.
Great, thank you so much, sir. Now we only have about 8 minutes left for this panel, and what I wanted to do was essentially for each of you panelists to please provide some input on what you believe your sector, your industry might need in order to achieve the future of healthcare. We've seen in some countries that they've been able to, well, New Zealand has been able to completely beat down the coronavirus. We've seen in some Asian countries that they have fantastic technologies for tracking and tracing and monitoring. Is there any state of the country where we might be able to, for example, have a private institution or private hospital that maybe Falah has invested in that has the data on how a patient was cared for? Maybe that patient now decided to travel, and the private institution is able to send that information to the aviation or an airline that will be able to say, okay, this particular patient should not be able to travel. Maybe that patient needs a vaccine and is sent over to GSK to receive the vaccine. This sort of interconnected collaboration that would be beneficial for us all. What might we need to actually achieve that? Is it investments in your particular industry? Is it the technology? Is it simply political will? So please, maybe a brief 60 or 90 seconds from each of you. What is your wish for how we can move forward and come out of this COVID pandemic in a better position than we were before? And if we can please start with, I would say, Mr. Kunle, please, from GSK, and we'll move to Fala and the rest of the team.
Thank you very much, Jenny. For the pharmaceutical industry, for the position for the pharmaceutical industry in Nigeria to better respond or to be stronger the next time around or for the next pandemic, one of the things we should do now is to promote and encourage collaborations between the global pharmaceutical multinationals like us and the local manufacturers. Collaborations come in many forms. One of the form I will refer to really will be in terms of contract manufacturing or toll manufacturing that will encourage technology transfer from the global companies to the local manufacturers. And again, the benefits of this is that this will further strengthen our drug supply system and, of course, our ability to respond to the next epidemic or the next pandemic. And I must say that the Central Bank's Healthcare Sector Intervention Fund provides much needed capital for local companies to upgrade systems, to further invest and reinvest in making sure that they are ready for this collaboration with global partners. And aside this collaboration, and to actually embed this collaboration, a contract manufacturing framework by the country, by the regulators in the country, will ensure a very significant
COVID-19 pandemic better than even before we went in. Okay, no problem. Moving on, we'll go back to Fola, please. If you could have some insights for us from the private sector.
I think, I mean, and again, just maybe, based on what we've been able to achieve together, I think certainly the will for a more broad-based PPP, public-private platform, certainly needs to be hashed out. I think it's great that government, Lagos State government particularly, and government in general have seen the role of the private sector in healthcare investments. There's certainly a significant amount of investment on the private side waiting to come in. In the last 10 years, private equity, for instance, in healthcare has grown to almost $2 billion. So there's quite a bit of capital, particularly based on the pandemic now, that's waiting to be let in, both to technology as well as to infrastructure. So I think harnessing that for me would be the real objective going forward.
Fantastic, thank you. Professor Iwu, what would you need? Is it money? Is it government support? How would you be able to come out of the pandemic better than before?
I think the CBN intervention is doing some good job now. But the major issue that we should move out from being just a consumer nation to a nation that produces. Instead of just having solutions handed over to us, we should be part and parcel of the solution finding. I think the big pharmaceutical companies should be made mandatorily for them to have in-house and R&D unit. A situation where these big companies come here to sell their products and we only are the tertiary nature of the industry is really not good enough. We are big enough that we should be able to make active masculine ingredients. We don't even make aspirin in this country. We don't even make Panadol in this country. There is no drug that's made locally. So the big companies should be mandatorily asked to invest in local research and development. That's the only way you can go forward. So that next time we have a COVID, not 19, any other one, or any other infection, we should be able to have homegrown solutions to those problems. Thank you.
Fantastic, fantastic points. In the event of COVID 2021, COVID 22 even, we'll have local manufacturing and be better prepared. And please, Mrs. Adeyemi, in 60 seconds or less, what would the air transport industry need in order to recover and ideally come out of this even better than before?
I think it's the collaboration between the health authorities and the aviation sector to ensure that the globally agreed and accepted measures for restarting and supporting aviation again are implemented. I think that's really critical. So that joining up the efforts to make sure that, we're not approaching things in pockets or in silos, and ensuring that, we're collaborating it to the fullest extent would really support our ability to restart the economy as well as, prevent the spread through our industry. And these measures that I mentioned earlier have been developed in collaboration with the World Health Organization and many of the international CDCs. So these are already standard and they're global and globally accepted. So I think that this would be very useful for that kind of collaboration to happen. Thank you.
And thank you all so much for your time today. We deeply appreciate you taking the time to speak with us, the insights that you've all provided to the audience and to me personally, I think have been really fantastic. So that is what we have discussed today in our session, COVID-19, how is Nigeria and Africa's trajectory different from the rest of the world? I pray that you all have a fantastic rest of your day. Please stay safe and stay tuned for the next session. God bless you and have a great day.
Thank you. Thank you.
Thank you.
Thank you. Thank you.
Thank you, esteemed panelists. Thank you so much for that insightful panel. We really gained some valuable information from that, and I hope you, our participants, gained valuable insights as well. Three main points that were made during this panel that were extremely comforting to hear were that the first thing is that we have a very different profile. The COVID-19 profile running through Nigeria is different from what we have in the Western Hemisphere. And that is actually affecting the numbers that we're seeing being reported by the NCDC. The second thing that I found valuable to know was that it's actually changing the face of the pharmaceutical industry. And going forward, stakeholders in the health sector would be able to make APIs for the local market, which is encouraging and wonderful to hear. And the third thing that was also encouraging to hear is that currently we have a vaccine in production, which would be going into clinical trials in the second half of the year. And after that, we're looking to produce 1 billion doses that would be effectively distributed. So those were some really valuable information that was delivered by the panelists. And I hope that that was also interesting to you as our participants. Please remember that the conversation continues offline. You can follow us on our social media platforms at Business Day on Instagram, on Facebook, on Twitter, and on LinkedIn. We also asked the participants to take some polls during this segment. And one of the questions that was asked was, did the lockdown curb the spread in Nigeria? And 63% of the participants believed that it did. Another question that was asked was, do you think the COVID-19 numbers in Nigeria reflect reality? And 87% of the participants don't think so. So those are some of the questions that we had, and it's interesting to see how individuals are responding to the COVID-19 pandemic. So at this point, I'm so happy that you're with us, and I hope that you stay with us and you also enjoy the rest of the panels over the 2-day conference. The conversation continues.
Hedel's COVID-19 Checker is an easy tool to use. Just enter the link hedel.medictor.com into your web browser and click OK. Then it takes you to the page Test COVID-19. You click and it takes you to another page that requests your gender. Pick a gender and you go to another page where you specify your age. After specifying age, it takes you to the main page where you enter your symptoms. You can see feeling of fever or cough, and you can pick more than one symptom. It further dives down and asks you which of the following symptoms you think is the most prominent, followed by a few other questions to ascertain diagnosis. Hedel's symptom checker then asks you to indicate your risk of exposure to the coronavirus. You can pick more than one option and click Enter. This is the result page. It says it appears you may have a high risk of COVID-19 infection. So you just scroll down and take the short questionnaire asking you if you're satisfied with the result. Click yes or no. Now, let's run through the results page one more time. The recommended action, click on it, and it shows you the numbers you can call in whatever country you are. For Nigeria, it shows you for NCDC and Lagos. There are numbers also for Ghana, Kenya, South Africa, and Tanzania. One very important feature, Hedel allows you to download the reports in PDF format on your mobile so you can send to your doctor or physician through WhatsApp or any of the social media applications or by email.
The tastiest blue band with vitamins A, D, E, B6, B12, folic acid, and niacin. So important for kids' growth and development.
You can tell they're from a blue band home.
by asking, before we go into the core of our conversation this afternoon, can you please provide a picture or a status update of the capital markets, and precisely what are the key features that you see today that define the capital markets in Nigeria?
Thank you very much, Frank, and thank you for having me on this webinar. From the introductory comments you made, I think you sort of, dimension the role of markets in an ecosystem or in a country. Where Nigeria is today, I dare say that to all the challenges or conversation we might be having, the most important segment of this ecosystem, of this, country called Nigeria, is capital markets. And the earlier we understand that we can solve most of our issues, and they're not major, so I'll call them challenges, through the market. The earlier we understand that, the better for how we're going to take this country to the next level. If you look at it, the finances, government finances cannot deliver on almost all the matters that should be of major concern to us in this country today. If we start from infrastructure, let's even leave the hard infrastructure and go to broadband. This has to be private sector led. If you look at the gaps in education, in health, roads, power, railway, and how important the transportation system is to the development of any economy and economic growth and activities, you will appreciate the fact that capital markets, the markets will play a major role. I read the treatise from the central bank governor on the COVID-19 tragedy to opportunity. If you look at the goals, what we want to achieve, take control of our economy, take control of our destiny, take control of our future, and you look at the sub-objectives of health, quality health care, education, food security, power infrastructure, the markets would have to be the major conversation. You saw the Infraco PLC of 15 trillion naira. That sounds like a lot of money, but this economy can deliver that. And what we need is actually to fix the DNA, what I call the DNA of this country in terms of the philosophy. What sort of philosophy do we have? If we're going to approach things from market perspective, then the architecture would have to support that. The strategy would have to support that. Of course, leadership is important, but without the DNA and us agreeing and codifying that DNA, we may be having this, stop, we'll achieve 2 steps and take 4 backwards and things like that. But to answer you in very simple words, the capital market is very, very crucial at this point in this country.
Thank you very much, sir. Now, I think it's fair that we do establish the critical nature of or importance of the capital markets, and how it is that you don't wait until you have solved all the problems before you start talking about capital markets. In fact, capital markets are part of the solution of the problems, virtually all the problems that we confront as a nation today. So how does a country like Nigeria take opportunity of the challenges that we have today to develop its capital markets and really create that bastion, that pillar that every thriving economy needs?
Very good point. Let us look at what we have in place and what we need to put in place. And I'll take the first box, and the first box will be infrastructure for me. Today we have the Nigerian Stock Exchange, we have the FMDQ Securities Exchange, we have the clearing houses, FMDQ Clear, we have the depositories. All this will go into what you call your financial market infrastructure. The regulator has registered some of these entities. We have the CSCS, we also have the FMDQ depository. So in terms of the infrastructure required as the pillar of what you're asking for, that is in place. We have very brilliant minds. We have top practitioners in this country. Some of them, they've always worked where, some have worked in the US and they're back here. We have Oscar Oyema, we have Agboje Mokwede. We have the capital market is, we have solid people here. We have people in CSCS and other places. We have some brilliant minds in FMDQ as well. So in terms of people, the stockbrokers, the trustees, the lawyers, the legal practitioners, all of them. Olaniwa Ajayi, Banwa Nigodalo, UUPO, the list is endless. We've got all these lawyers. Then we go to the investment bankers, the Bolaji Baloguns of this world, Kyle Akikwe, a long list of them, Tayo, okay, well, we have the people in the market, Kyle they follow. So again, if you look at that box of after the infrastructure, the people to drive the business, we have all these people, of course, taking over from our seniors in the past, the Mr. Peter side, Wale Edun, and co. And also the entrepreneurs in banking, Mr. Ovia, Mr. Adiola. Again, the second pillar of people we have. What we need the legal framework, the regulatory framework. Again, don't get me wrong, we've got the brilliant regulators, but in the absence of the legal framework, so many other laws that we require, Nigeria is going to be slow in taking off. And without this legal framework, the required liquidity and the quality of participants we're looking for will not occur, because when outsiders look into the country and they engage the investment bankers and the lawyers, the first thing they ask for is law. The next thing is regulation. What sort of regulation do we have in place? Again, there must be perfect alignment between, you remember I spoke to the DNA box, there must be perfect alignment between your philosophy and your regulation. If you're driving a market-driven economy, then regulation cannot be restricted. You cannot have administrative rules. So they have to align, and that is how the wheel will start. So if you ask me in terms of global competitiveness, and you look at the pillars, the stakeholders are there. We've got, everybody we need in this country. We have the entrepreneurs, Alhaji Dangote, we have the Tony Lumelus, we have all these people in place. But all of them, all the senior bankers in the country and the bank CEOs. We have the seasoned regulators. We have the financial market infrastructure, the depository, the clearinghouse, the exchanges. They're all in place. You have FX, the commodity exchange in Abuja. We need laws and we need government. We need regulation. Whilst government is small in terms of the percentage of our GDP of the expenditure, we have to recognize that if government does not put some rules in place or enable or open the economy, we may not be able to get to the promised land. Government is so critical, and I think our global competitiveness, if you ask me, over 5, I think the score is still low. And as you said, going back to your first question, the earlier government sits with the capital markets, and the government will say, where do we need alignment? What do we need to do so the markets can drive? Look, the total bond market, non-sovereign in this country, is less than 1 trillion. But if you look at the pension funds, the figures are rising every day, because every month, COVID or no COVID, we're sending money to the pension fund administrators. Now, if you have the right philosophy, you've got to ask the question, the pension that we're all piling up, at what level is it being invested? And is it above inflation? Because this is money that will come in future. So we can't just, sit and be throwing things up. We need to say, what is our philosophy? When we answer the question on our philosophy, and we all agree that this is the philosophy of this country, then we'll be able to write rules. PENCOM will know what is going to approve for the PFAs. And somebody in this country must be interested in the real return on our pensions. We don't inflation cannot be 12, and the pension can only invest in assets that are bringing 6 or 7%. This is dangerous for the future. So if you ask me again, looking at what we need to tap into the numerous opportunities in this country, a simple alignment of our philosophy with regulation and also legal framework to underpin the success that we require. But those things are not as easy as said, because everybody, all the stakeholders, from the leadership of the country down to civil servants, everybody must be in sync. If we don't achieve that sort of perfect harmony, we're going to struggle for long.
Well, thank you very much. Thank you. You know, as a journalist, I tend to meet people from both government and the private sector. And I can tell you, I mean, I have done this over a good number of years. What I find common is that people in government want to see progress in Nigeria. Those in the private sector also want to see progress in Nigeria. Truth is, the private sector people might be a little bit more patient. They probably want things to go faster. My sense is that both parties have an identified common destination. How do we begin to create the kind of alignment between private sector and government in relation to the capital markets, that we understand, firstly, that the global economy is moving and it is not waiting for Nigeria. Secondly, that our own economy, to a good extent, is plugged to this global economy that is moving, and leaders of businesses in Nigeria want to run as fast as their peers elsewhere are running. They want to be able to access capital markets as quickly, cleanly as their peers elsewhere are running. Because in the end, the dollar is dollar. You know, I mean, in the end, you have a basic way of valuation. And so you are struggling against people wherever it is that they are in the world, but you are looking at the same kind of numbers. So you talked about pension, for instance. How do you invest the bulk of the pension in assets that generate 6% when you are dealing with inflation at multiples of that? So that's my dilemma, and I'm sure that is yours as well. But how do we get this conversation to lead into the point that not only is it that we identify a common destination, that we are actually walking lockstep and barrel together, private sector and public sector, to ensure that we do this in good pace and run?
Thank you, Frank. This is a conversation that can take us hours, but I'll try and see if I can distill this in two big boxes. The first box, as I told you, is that DNA. Okay, what is the philosophy? Where is leadership? What is the strategy? And then you look at architecture. Once you get this four codified, then leadership will drive that alignment. The leadership sits with markets and sits with the other stakeholders and would sort of tell everybody, challenge everybody, and say this is the direction. So there's mindset. The people in government would have to understand that there's no attempt by the private sector to take over some quote unquote power from them. They are the ones in power and they are in control. But in terms of how the market will support, I think they have to concede and allow the market to give a template of what is required from government to support, and for them not to doubt that oh, maybe there's some ulterior motive. If we speak with government and we say we want you to privatize this, we want you to give us a law that ensures that we can have netting, we can have, you operate central counterparty clearing, we can have netting of checks, we can do all these things. We're saying these things for the economy and for all the stakeholders. So if I look at the capital markets today, how can we support the SMEs? These are the sort of conversations we should be having. And once we give a template to government and say these are the requirements, look, our friends Jayola and the NESG, the Nigerian Economic Summit Group, over the years, some of our seniors and big uncles, Pastor Dozie, have led all this, and you're aware, the Kremer. These have been the conversation. And as you said, both parties will say we agree. But go back and test that alignment, and that is where we start falling short. But I think, I would say those two boxes are the philosophy and the architecture, and then you link this to the mindset. And for the parties to know, the private sector will be interested in what is the need for it, because it is when the private sector rolls that engine that capital comes in. As you said, look, when people have capital, whether Nigerians or foreigners, they think of growing their capital. So when people tell me about hot money, I say hot money doesn't just come from outside. Nigerians here as well will think of their wealth and think of the value of that wealth and would never want that value to drop as much as possible, because they're operating as economic agents. So for me, I think the conversation happens all the time, but it is when we have to implement and the private sector says, look, this is a list of 20 things that have to be done by government. Then we need to ensure that the civil servants and the politicians are aligned. And where one party, because again, the politicians, even if they are aligned, they have to ensure that the civil service is ready, and nobody in civil service is saying, oh, must we do that? No, the country, the government must control all these things. I think we need to talk a bit about this, but permit me to say who has responsibility for it is the man with the initials PMB.
Thank you, sir. Now, I want us to look at, in the situation that the world finds itself, the importance of capital has become really at the very top. I was looking at the report on Bloomberg yesterday. Egypt, for instance, had the government, that is, created guarantees for small businesses to take credit from the bank to the tune of $12 billion. And they suddenly found that the pace at which the loans were being disbursed wasn't fast enough. And the government yesterday moved in to relax the conditions and to ensure that that pipeline wasn't dry, that it kept flowing, with cash for small businesses. Now, Nigeria is in a dire need to diversify its economy. The diversification of that economy cannot happen without significant amount of capital flows. What is the place of policy and the place of organizations, private sector organizations like yours, in ensuring that post-coronavirus pandemic, that this economy gets all the levers that it needs to run, and that businesses, have access to the capital that they need to recover from the pandemic and to begin to grow and grow very quickly?
Thank you, Frank. Again, the topic on diversification in Nigeria, I think I've been writing about that since I was an economics undergraduate in the University of Ibadan. I'm not sure we're very sincere with diversification, because if we are, I think that's enough time. I left that university about 34 years ago, or 35. And I'm sorry to say, leadership is so critical in that DNA box. And, you know, there was a time, I think 2015, 16, when crude was going down. Some of us were wishing it was going to stay single digit, quite honestly, because it appears Nigeria is waiting for a major fall before it decides to do, you know, no sooner this crude goes down, the diversification conversation is what you hear everywhere, then it starts going to 40, 50, and everybody walks away. It looks like it's just too simple. You know, the money comes in, and what's the point with going through this diversification again? We need the leader that's got that vision, and I think we have one in place now, that can see 40 years of Nigeria without crude oil and get all the brilliant minds to sit down, and we codify, if possible, legislate what we have to do. That there are brains in this country and we have the political will, we can do it. But I think oil is just cost us major problems. And because it doesn't stay down for so long to help us, you know, use our brains rather than what we can get from, you know, that oil, we quickly jettison whatever our agenda is and move on. You know, I read the piece from the central bank governor, and each time with my colleagues, we go back to that one pager. We've done a lot on COVID-19, tragedy to opportunity. If we're not careful, we're going to miss that opportunity again. So we looked at it in FMDQ and we said, okay, if in this economy as big as the Nigerian economy is, the total bond market is less than 1 trillion, then there's a problem somewhere.
Sure.
Are the private companies funding themselves? So we decided, approval of the board, to go into what we consider private capital. How would capital get to private companies? And most companies in Nigeria are private companies. Companies are going to lead infrastructure are going to be private companies. Companies are going to lead healthcare, they're going to do all these things, they're going to be private companies. How do we ensure they have access to this capital? The pension assets, the fund managers, the money's with them. How do we ensure that people, private companies can do that? We read the governor's piece. Again, it was filled with activities of private companies, agriculture, education. And we said, you know what? Maybe we have an exchange, but maybe what we need is a platform for private capital. And we've put one in place. And we're happy that, you know, our big brothers, Nigerian Stock Exchange, is also beginning to see that. Because they too, they've been in operations for 60 years. They've done a lot on the equity side, and they can see that the total market cap in that space is not even up to 15 trillion naira. So if you look at that, the equity market and the Nigerian economy, there's no super connection. The correlation must be very low. So we're so excited that both of us are going to be talking about private capital. But the central bank has opened the opportunities. But don't let us open the opportunities and not follow up with implementation.
Right.
Implementation is the most important thing. So if you ask what is FMQ doing to support the post-COVID world, it is how to ensure we facilitate an easy, seamless, you know, way for people, private companies to tap the capital. And our vision is to be the private capital platform in this country leading in 2024, where they can talk to the transaction advisors very quickly. And there are other companies that are going to work and support them, because some small companies, and don't get it wrong, private companies are in 3 boxes: the small, the medium, and the big. There's some big companies. Right. Before MTN became PLC, it was a private company about 2-3 years ago. So all of them must be able to tap the asset management base of this country. The pension fund, the regulator has already approved and allowed private equity, is the same way that people can do private debts. Private companies must be able to issue short-term paper, long-term paper. It's not only equity. At times, they don't even want to dilute. So what they're looking for. So those 2 platforms, if we've started as, we believe the Nigerian Stock Exchange will soon start, and then both of us working again together to sort of unleash the entrepreneurial energy of Nigerians. We get it wrong at times, thinking it's all banking sector. No, the pension fund, the insurance companies, the asset management firms, all sitting on, you know, assets as well that can be deployed to support private capital. And that's space that we need to watch and support. And we believe that the regulators, those we've contacted, are supporting this already.
Thank you very much. Thank you, sir. Before we round up, let's turn our attention to the foreign exchange market. What impact is it, in your view, will the current foreign exchange regime have on long-term capital formation and aggregation in Nigeria, given that that is very critical to borrowing as well?
You know, the conversation on foreign exchange is very interesting, but the foreign exchange market is the nervous system. So if you look at the human body and you appreciate what the role it plays, that is the foreign exchange for your capital market. And if you read some books, you will hear how the capital from Japan built homes for Americans.
Sure.
Because we put the right foreign exchange market in place, the right market structure, with the right regulation, capital, as you said earlier, all over the world will travel. Capital travels faster than human beings. And they're looking for opportunities and yield, and also looking for how to protect the yield. So you want a great debt market, the debt capital market, an equity market. The FX market must be world-class. It must be the most attractive. So when of going in and going out of your country, it must be seamless. You must give that sort of FX market. If you look at the commodity side, you need to do the same thing. If you look at housing, if we have mortgages in this country and we're able to securitize them, foreigners will buy foreign capital. They're looking for yields. As long as the yields are good and we can hedge. So again, one of the conversations in FMDQ, working with all the stakeholders, is risk management, derivatives. You must be able to hedge. If you anticipate a risk, you must be able to hedge. We've talked about the importance of the foreign exchange market so much without us getting it right. It's going to slow down FDI. It's going to slow down foreign direct investment, because people will say, I'm bringing $1 billion to Nigeria. I'm going to be here for 30, 40 years. That capital I want to ensure is not locked. You know, so there's a lot of work to do. And again, to lead that conversation must be the central bank. And again, the central bank, what sort of FX market will support the sort of economy we want to build in the next 20, 30 years? We don't have to be the ones to do it, but we must codify it and nobody must deviate from it. The issue is, once there's little crisis, we tend to think we need to deviate from it. No, markets work stronger when the governance is high, when credibility is high. That will bring confidence, and on the back of this, you're going to have your liquidity. So again, simple terms, without an attractive FX market, we're going to have challenges for capital to pour into this country in the magnitude that it should. And there are too many opportunities here in Nigeria at the moment for us not to have dollars pouring into this country. There are just too many. But we're watching and we're aging and we're looking at this missed opportunity, and we hope that we can do something pretty fast.
Thank you so very much. You know, in the mid-90s, there was the head of the IMF in Nigeria, Dr. Ishaq Hussein. And his theory then was that there was a positive correlation between oil price, global oil price, and seriousness of Nigerian government officials. That when the oil price is high, they never tend to be available for any meetings. But when the oil price goes down, they are the ones who knock on the doors of the World Bank and the IMF asking for meetings. So I get the drift that some people will even pray that oil price stay low for a very long period of time so that our government officials can be a bit more realistic. But Coco, we must end this conversation here, given that we have to clear the way for our next session. I'd like to thank you so very much, not only for joining us, but for the work that you do both as a person and as head of FMDQ. I know we have traveled a number of times, met the same kind of investors, some of whom invest in Nigeria and have been here for 30 years, and we have together heard the comments that they make. But I like the hopeful note. We must believe that at some point that our leaders will free themselves and just do the right thing, given the huge potential that is called Nigeria. Once again, I thank you so very much, and I wish you the very best, sir. And at this point, I'd like to hand over the microphone to my colleague, who will take us in a short interlude before our next conversation or the next session in our conversation will start. And I bet that we have provided some inspiration, and we'll continue to provide some inspiration for the next 2 days. Thank you once again, sir. Thank you, sir.
Thank you, Frank, and thank you all. Cheers.
Hello, welcome to Culture Code. Today we're going to be going in there to meet with the director of the first private museum in Nigeria. This is the Yemisi Shillon Museum of Art in the Pan-Atlantic University in Ibejuleki. We will be meeting with the director, Jessica Seyote, who's also the architect of this building. He will be telling us about the ambition of the museum and what they have in store for the 19th of October in a month's time. Come with me. So, how did it all start, Jess?
For years, we were talking with several collectors about the possibility of setting up a museum at the university. And eventually, a few years back, we agreed with Prince Shillon. He generously donated or agreed to donate over 1,000 works from his huge collection. Then he also agreed to provide money for the building, and then we started planning what type of museum, what do we want to achieve, why a museum, what is the model we are going to follow, how are museums in universities. So it took us quite a long time to define. This is not a museum whose primary objective is to attract visitors. This is not a museum like a national museum that has a primary mission of preserving, documenting, displaying a national heritage. The focus of this museum is narrower. We want to use this as a resource, as a tool to teach.
So how do the students, for instance, you have engineering students here, you have students of communication, economics, how does a museum teach them?
The museum is here not only to teach about art, because not everybody is interested in art, but is to teach with art and through art.
So now you're talking about the audience-centered, of course, the engagement with the works. Does that explain the design itself?
when
did you have that in mind?
Thinking about the physical structure that will serve that educational idea. So first, we have to define what type of museum we want.
Exactly.
Why do we want a museum? What do we want to achieve with a museum? Now, so far I haven't mentioned much Prince Shillong.
Yes.
This is not my idea, or it's not just the Vice Chancellor's idea. Here, Prince Shillong is a prominent role on this. Why did he decide to bring his collection out? He wants to offer a service to society by bringing his works to society. Now this links very well with the educational mission of the university.
So probably a convergence of interest, you could say, just you there in the middle, making it happen.
I wanted a space that disappears. It's not like some of the contemporary museums where the architecture is, in some cases, more important than the artworks. I wanted the architecture to serve the educational purpose. So this is an object-centered display. So by leaving the walls a little bit dark, in darkness, and then highlighting the object, then the object glows. In light.
Gets the attention.
Then is the focus. So the architecture has to serve that purpose.
Because I know you've always mentioned when you talked about it that if you could get, for instance, a busload of
And I don't know if you hear it.
Yeah, we can hear you well. It's just that, can you push your video button?
Okay. Yes.
Right.
Yeah. Can you see me now?
Yes. We can see.
Right. So welcome to this session, ladies and gentlemen. I think it's an interesting subject to talk about governance. And I think the first two sessions, the one on COVID and the one Frank, my dear friend, had a fireside chat with the boss of FMDQ, revealed something about governance. The whole issue is about governance. How have we been able to manage COVID in the context of governance? You could see the institutional void and institutional failure. So what we're going to be discussing is, are we at the appropriate level of governance? Are we delivering services? So what I did was I looked up the World Bank's pillars, and it talks about 8 pillars: voice, which means the press has to have a voice. There has to be an opposition voice, accountability of government, political stability, no violence, government effectiveness and efficiency, regulatory quality, rule of law, control of corruption, and I've added one, elite consensus. As you all know, you may agree or not agree, part of our problem is the failure of elite consensus to get a good governance framework. So these are the things I hope that we can share. People always talk about the fond days of Awolowo and Zeke and Saudana, and where are we today? I think we'll all agree that our dear country is extremely fragile. How can we, what are the lessons to learn from the past? So I'll direct the first question to Chief Philip Asiodu. As you all know, a distinguished public servant from the 60s to the 70s. So Chief Asiodu, when you look at the governance framework today and what it was when you were very active as a super permanent secretary, Are there things we can learn from the past to improve the governance landscape today? We can't hear Chief Philip Asiodu. Sorry, can you all hear Chief Philip?
No, he's on mute.
Okay. You can hear me now.
Yeah, we can hear you.
Yes. I was saying it is a very, very sad situation because I entered just before independence into the civil service, and I ended with the coup of 75. But since then,
it's 1 o'clock.
Pardon?
No, don't worry, sir. Don't worry. Go on.
Since then, I had 3 occasions to go back as an advisor, economic advisor, in the second administration of Shehu Shagari, then in the Transitional Council of 1993, and then finally at the beginning of this last republic, this current republic in 99. And I could see terrible continuing degradation. Degradation in terms of competence, degradation in terms of willingness to work. You know, many governments can say what they like, plan very well, but the destruction of the public service in 1975, compounded again in 1988 with the so-called reforms of 1988, which were reversed in 1995. It's so painful. For instance, 1975, we abandoned planning. You know, the 75-80 plans, when we come to talk about it, we will see the significance and the projections then. They abandoned it, then they abandoned the discipline of planning, and then the traumatic purge of the public service brought in the idea of make hay while the sun shines. Since people were dismissed or retired without due process, whether you were good or bad, so that undermines. So long as you have this current situation where anything goes, corruption is rife from top to bottom, you can't deliver. So I think when we come to talk about that, structures are one thing, the attempts to retrain are there, but if the motivation and the leadership make it impossible to be honest, painstaking, you know, you really can't progress. So whatever we do, we have to come back to how qualitatively to improve the people who have to deliver.
Right.
It's really the public ministries and agencies.
Thank you very much for that. I'll just make a couple of announcements. The first is that we're running a questions and answer program. And for the participants, if you have a question, please type it up and refer to a specific panelist. You need to go to slido.com to ask your question. When you get to slido.com, you would need to log in into a code, hashtag BD, capital B, capital D, small ANC 2020. I'll repeat that again. Hashtag capital B, capital D, small ANC 2020. We are also running an opinion poll, and the results may be announced in the context of this session or later, so keep that in mind. I think I have 5 panelists, because I have 7 on record here, but there are 5 panelists. And I see Governor Peter B next to Chief Asiodu. So I might as well ask him Governor Peter Obi has spoken very eloquently on the question of governance, the cost of governance, limited government, efficiency of government. So, Governor Peter Obi, perhaps you'd like to expand on your notion of limited government and reduction of the cost of governance, particularly in the context of this government now recognizing the need to implement the Rosayan report. Governor Peter Obi.
Well, thank you. I hope you're hearing me.
Yes, clear.
Yes. Okay. Well, thank you. I listened to our father, Asiodio, when he spoke and everything. First, I have to start by if you look at what is happening in the country today, is a cumulative effect of leadership failure over the years. No matter how you try or whatever ideas or plans you have, if you have the type of leaders we have, and when I mean the leaders, myself included, because when I say leadership is not just the president or governor or this, I'm talking about all the leadership, whether it's House, local government chairman. If you have the quality of leadership we have today in our country, you're not going to do anything. You're just a case of where you have a situation where you want to fly. Probably you have 10 planes that needs to fly, and probably you have 1 or 2 who are pilots, the rest are drivers. They don't know how to fly, so no matter what you do. So we have a situation where we need, our leadership selection process must change, and we have people who have the capacity, the competence, and everything. On issue what you're talking about costing and all that is not something, it's something you need to see, again, I said, across the various strata of government. If I use states, for example, to give you an example, because we always talk about federal government, of course, it needs to be aggressively, but look at the local government, look at the states. Let me use where we are now, like COVID-19. Every local government in this country receives every month about 100 million naira. At least every local government, every month. In the past 3 months, March, April, May, we have found ourselves in this situation. It cost only 15 million naira to set up a testing lab. And yet, some states don't even have testing lab till today. A ventilator costs only $20, about 10 million naira. We have a state without a ventilator, but the same state have Prado jeeps for the House of Assembly members. No, it doesn't happen anywhere in the world. So you can go on and on and on. I was just yesterday telling somebody that between year 2016 and year 2020, Nigerian budget for health is 1,896 billion naira. That is what we budgeted for health. And then if you add education, which was about 2.8 trillion, both of them was 4-point-something trillion, which is just about $12 billion. When South Africa in 1 year budgeted for health, these 5 years, education and health put together, South Africa in 1 year budgeted only for health, $17.6 billion. So our entire budget for 5 years is the most critical 2 areas. It's not up to South African budget for 1 year. If you listen to what Coco said now, that Egypt have provided, just last year, that Egypt have provided $12 billion for their SMEs. South Africa provided 5.5 billion. The only thing we have provided here is central bank 50 billion, which is $125 billion. So if you look at all this, I know you have wonderful panelists. Let me allow it, but if you look at all this, we're just not serious.
Thank you very much. Thank you very much. I'll now go to Aliyu Modibo.
Thank you very much.
Yes. Governor Peter Obi identifies a big governance void, which I think has been amplified by the coronavirus. Before, we thought we were, with a good health care infrastructure, but it took COVID to show there was nothing. What are the sort of things we can do to close this governance void? If you agree there's a void in the first place.
Thank you. Yes, there is a void. I think we have to start by critically looking into the recruitment process into public service. And when I say public service, I'm taking the whole spectra of service, civil service inclusive. So, and to also reduce this division or dichotomy between political authority and the central bureaucracy. There's this disconnect. Politicians or people with political authority are thinking this way, and the public servants, civil servants are thinking that way. Let me give you an example. When you take, people say that, planning has been thrown out of the window or so and so forth. Just, we keep repeating it. But I maintain that planning is going on, except that it's not the right way to plan. Planning is going on. Every year we have a budget. All the institutions, tiers of government, we have budgets. But the template for budgeting process has not changed since the 60s. We have not sat down and say, okay, we have this amount of money we want to spend on infrastructure. Which infrastructure? Is it health? Is it education? And then now, how do we do it? But now, if you have had an opportunity to serve in any of these political posts, either governor, minister, or whatever, and you are not careful, the budget comes to you, already the template is there. All you need to do is the civil servants will give it to you, and it is the same item, same subhead, same expenditure, the same thing that were bought, the same line vote will be there for them this year. So unless if you are careful, you don't take the budget, this bulky document, to look at it, and it has spilled into the National Assembly, who are even supposed to be a little bit more careful. Now, so the problem with us now is for us as a nation to sit down critically and examine the training institutions. When you take our institutions of learning, for instance, they have not regenerated. We have so many of them, hundreds of universities, but they're teaching the same thing. There is no institution that you will go that you will be so shocked because they will pick one radical paradigm shift, from the way we've been doing business. So I think really, if we can even have a summit, instead of discussing this, whenever we make reference to summit or national conferences, let's have a conference, even if it is on a small scale, each area, each state or each municipality. Let's look at examine of why are things not working for us. Let's not waste too much time on talking about politics. I believe that the Nigerian life, the Nigerian situation is almost 80% on a daily basis occupied by political debates, not by developmental debates or economic debates, or how do we move forward from A to B. Thank you very much.
Thank you so much. I think I would, if you can give me the screen so I can see all the panelists, please, because I can't see everybody. I will assume that Mrs. Ike Mokwede is in the house. Am I correct? Mrs. Ike Mokwede. Hello?
I can't see him.
Yes, I'm here.
Right, okay.
Okay.
Yeah, good afternoon.
Great. I don't know if you can speak to, I mentioned a couple of things that the World Bank set out as pillars of good governance. And I talked about accountability. I talked about regulatory quality, transparency. If there's a budget and it's not transparent, it's useless. It doesn't help governance. Part of the problem of Nigeria has been we budget money, but we don't know where it's going to. So what's your thought about that?
Well, I think a lot of the panelists have raised important points, and governance is at the center of the points that you have raised. If there is not proper governance, it doesn't matter what you budget, how you budget, what planning rules are in place, nothing is going to get done. And without proper governance, you see the challenges that we in Nigeria have faced. The issue that I think that a lot of people have failed to recognize is that we were able to be successful in the past, as Chief Asiodu has mentioned. The Nigerian public service, civil service, was very effective after independence and up until the 80s. And so what is the difference between what is happening now and what happened then? And I think a key factor is the lack of investment that we have made in governance and in the public servants. Now, one of the panelists talked about the quality of the public servants, and you have raised the issue of the lack of accountability. But if you compare all the systems that are in place in the civil service, for example, who are working with the training systems, performance management systems, the selection process, remuneration, all of these things are very weak. And if you have systems that are so weak, you will have civil servants and public servants who are not motivated. That is why they fall privy to corruption. That is why they have no interest in being effective in their jobs. So until we look at what it is we are doing with our civil servants and our public servants, until we start to invest in them, it doesn't matter what we say that we're doing, we're not going to get the results that we require. So for example, a director level civil servant who has had up to 30 years experience earns approximately 500,000 naira a month, which is the same as what a graduate who has 2 years experience is earning in the banking sector. So how can you expect a director, unless he has some intrinsic personal motivation or he has some funding from somewhere else, how can you expect him to do the job that he has been asked to do when he looks around and sees how neglected he is? So I think that when we're talking about governance, we need to look at the quality of the public servants and the civil servants who are supposed to be doing the job, and recognize the fact that if we do not invest in them, if we do not raise them to the level where they feel empowered, where they're properly trained so that they can be effective, we're not going to get the results that we're looking for.
Thank you so much. I'll come back to Governor Peter Obi, just to ask you, recently the president passed Executive Order 10. A lot of people said it was unconstitutional, but I thought it was good because it held the states accountable. The states are supposed to remit funds to an independent, because here I'm talking about strong institutions, remit money to a strong judiciary and a strong legislature, but they don't do that. So for me, the intent of the president was right. The intent in the COVID-19 management, whereby there's a lot of decentralization of power from the national to the states, is also right. So I just wondered whether the governance issue behind Order 10, which is decentralization, would help governance generally, by which I mean, is the federal government too strong? Would it help if the federal government and the states, and that's what I meant by elite consensus, could come to a new political arrangement whereby the 90 items of power in the exclusive list and the concurrent list, 68 are exclusive to the federal government, 30 is concurrent. In other words, the federal government can have a bite at one of the 30, and if it does so, it excludes the states, meaning that really the federal government controls all items. Things like driver's license, marriage certificate. Why should the federal government issue me with a marriage license? So I want to know, Governor Obi, whether you thought we ought to be looking for new political arrangements whereby we distribute power in a better way to create a better governance structure. I'm unable to see how the Inspector General of Police can effectively provide detection from Abuja. What do you think, sir?
Well, and I'm sure you know my stand on issue of restructure, that I support restructure 100%. I've said it repeated, even when people ask me about the so-called presidency, Igbo presidency, or something like that, and everything. I said to them, presently you have a car that has an engine fault. Changing the driver is not what should bother anybody unless we fix the engine. The country needs to restructure Order 19, Order 10, or whatever that came out of it. Yes, I support the fact that we have to have the executive order. The executive order was necessary because we needed to have proper funding, especially to the judiciary. Judiciary should not be at beck and whatever it is of the governors in the states, especially to the judiciary. But what I see always that we're always thinking about how to share. We need to spend more time on how to create wealth, how to put in place things that will make the country to grow economically. And that is the order I want. I want to see the executive order about savings. I want to see executive order that is saying this amount must be invested in so and so. I want to see executive order saying if we must borrow money, it must be for investment, not for consumption. That's the order the country needs.
Thank you. So, Aliyu, what do you think will help improve the governance process?
Odisa, I don't know whether I've been dropped from the panel.
I'm so sorry.
I thought we were going through the panelists.
I'm so sorry. Because I was looking at the screen, and unfortunately, I didn't see you. Because I have your name here, but I didn't see you. So I would ask you to come in, please. I'm very sorry, I apologize.
Is that also the case with me, Olisa? My name is Obi.
Oh dear.
I think Olisa doesn't have a list, so.
The list.
Yeah. He's going by who he can see.
No, I have the list, but I didn't see Jibril nor Obi. I apologize for that. I really apologize. So, Professor Jibril Ibrahim, welcome. And I'm sorry that I omitted you. I don't know whether Bashar J.K. Randall is on the panel, is he?
Yes.
Yes, I am.
Wow. Okay, what I'll do, Jibril, let me start with Bashar J.K. Randall, and then I'll come to you, and then I'll go to my very good sister, Obi. So, Bashar, your very good friend, Chief Philip Asiodu, was telling us about the days of old, because we're discussing governance in the context of COVID. The first panel dealt with the structures of COVID, how it has progressed, and I identified immediately some governance questions. So, in order to rebuild the governance process, I'd like to hear from you what you recall of the past, Zeke, Awolowo, Saudana. What is it that we can learn from what they did when they governed Nigeria in the 60s?
Well, you are right on the button when you refer to Chief Philip Asiodu. What you may not know is that he grew up on Andrew Street in Lagos, which was right next to Tokumbo and Rika Street, where I grew up. So we both grew up in the same environment, more or less. But much more importantly, in the old days, Zik, Awolowo, Sardauna, even the Governor General of Nigeria, they were accessible. Unknown to the present generation, there was a telephone directory of everybody, from Governor General, Inspector General of Police, Chief of Army Staff. It listed their address as well as their telephone numbers. And I remember, even as a sixth former, I sent a letter to the Prime Minister that I would like to come and interview him for my college magazine. And I got a reply within a week that by all means I was welcome. That was Nigeria of those days. Even when Chief Asiodu was permanent secretary and held one of the most important positions in government, if you couldn't catch up with him in his office, he was at the tennis court virtually every day. So if you had matters of importance that you wanted to discuss with him about the Nigerian economy or the policy he was advocating, he was more than happy to discuss with you. And the same went through the entire system. Cabinet office was a beehive. People like, there was a gentleman called Alhaji Abubakar, and he had assistants like Patrick Deleko working with him. The official closing hour was 3 o'clock, but you are welcome to come and chat with them anytime after 3 o'clock, and they stay till 6, 7, and by way of entertainment, all they offered were groundnuts in those days, because they felt that everybody had a stake in the policy making. So let us now address a very fundamental issue. No country can be greater than the sum total of all its citizens. I repeat it, no country can be greater than the sum total of all its citizens. So you cannot expect to be judged by the quality of the likes of Chief Agbakoba or the likes of Chief Asiodu or any Zekwesili or former Governor Obi. We have to drag everybody from the bottom up. And that has been a problem. When we used to plan, we plan for everybody. But now you have a situation where all sorts of projects end up in the plan, but nobody ever asks, where's the budget? Where is the policy to support it? And we've just been going round and round in circles. What we are now dealing with is not just a crisis of monumental dimension regarding the first wave of the coronavirus and the consequential disruption. We now have to contend with the prospects or aftershock of an imminent second wave, together with the threat of a far more virulent strain. Sadly, even more worrisome is what will appear to be lingering complacency in the interval between the first wave and the second wave. And that's why we are now. Granted, we were caught unawares by the first outbreak in March. Some of the states, Lagos in particular, quickly delivered a robust response. Perhaps some element of fatigue has crept in, not necessarily on the part of the government, but more on the part of the citizenry, largely on account of the long period of forced hibernation, incarceration at home, especially those denizens of the informal economy or black market who depend on their meager resources, which must be replenished on a daily basis for their survival as well as that of their dependents. Even doctors are exasperated as the new strain apparently kills within 4 to 7 days, subject to confirmation by the World Health Organization, with symptoms resembling esophagitis, but more aggressive and fatal. But the victims and non-victims are trapped in stasis and marooned in a toxic environment dominated by mixed messages between international data and statistics and information being relayed locally. Even within our own borders, there are conflicts between what the federal government has announced and the defiant posture by some of the states, particularly Kano, Kogi, Cross River, and River states. We appear to have been caught off guard, even as we clamor for a return to normal. Reality compels us to redefine the new normal. For sure, things will never be the same again. We are almost overwhelmed by glaring evidence that in spite of all the zeal and resources invested in convincing all and sundry that COVID-19 is real, a significant percentage are in denial. This is derived from long-standing mistrust, deep-seated resentment, and outright cynicism. Even when palliatives were being distributed by politicians in the midst of the pandemic, the response from the beneficiaries, instead of gratitude and appreciation, was to carry out a double check among themselves. Is another election imminent? That is the only time the government and politicians remember we exist. As Mother Teresa pointed out, the feeling of being unwanted is the most terrible poverty. The figures we are contending with are staggering. As we speak, 8 million people have been infected globally. In the United States of America alone, the computer model of Johns Hopkins University is projecting 150,000 deaths in 1 month's time. In our own case, we are still battling with conflicting data, statistics, as well as what will appear to be discrepancies generated by a combination of unreliable tests and faulty testing equipment. And even if you look at the front page of today's Business Day, it says very clearly that our debt service ratio is now close to 100%. Debt service ratio of 100%. How do we go with that? That is a huge challenge. And if you look at yesterday's papers, one of the headline of one of the papers was that the importers has lost 15 trillion at the ports in the last 3 months. And the same thing for the budget. We have a situation where the government is not ready to slash down on its recurrent expenditure. It's not ready to compromise on the capital expenditure. So what you have is massive borrowing. But when you borrow massively, two things are likely to happen. Your foreign exchange, you have foreign exchange issues. Then on top of that, capital flight. And on top, in addition, you are going to have to deal, with this disruption in your economy. Not least of course, that you even run out of money.
Yeah. Thanks very much, Bashir. Thank you very much. We'll come back to you if we have more time. So I'll go to Professor Ibrahim. Participants, Jibrin runs one of the most efficient and leading centers for democracy and development. He's a good friend of mine, old friend, part of the pro-democracy movement back in the day. Jibrin, I don't know, I'm sure you've listened, although I missed you, I apologize again. Yeah. But what do you think in terms of the governance model? I know you've done a lot of studies on this. What would be your recommendation for a model governance situation for Nigeria, having listened to a lot of the panelists?
Well, my sense is that it's not really a question of a better governance model. It's much more a question of understanding what's the governance system and seeing what results such a governance system produces. Our Constitution says the purpose of governance is the security and welfare of the people. What COVID does is that it shows you there is no relationship between governance and the welfare and security of the people. 2 states in this country, Kogi and Cross River, declare there is no COVID-19 in their states because it makes them look good if there is no COVID-19. In both states, the medical association say we are getting patients with COVID-19 every day. Don't tell us it doesn't exist. We should work out how to take care of these COVID patients. This has been going on for 2 months, and nobody in the system will say these 2 governors are basically irresponsible and are doing the exact opposite of what the Constitution says they should do, provide for the welfare and security of the people. When you look, therefore, at our system of governance, it produces opportunities for politicians, except, of course, Mr. Obi, to go in and ransack the government for their personal aggrandizement. I recall when a certain kidnapper called Evans was arrested and he was interviewed by journalists. Why are you collecting so much money from your victims? And he says, oh, I have an ambition. I want to be the governor of my state. So I know that to be governor, you need to have a huge war chest. So I'm just preparing for that eventuality, which means governance is not about serving the people. And I think when governance gets to the stage it has in Nigeria, you have to identify what's broken. And what's broken is simple and straightforward. The accountability mechanism between the citizen and those who exercise power on their behalf. And I think when we look at our 21 years of democracy, 2 key events were important. The 2003 election, 2007 election, when the Nigerian political class showed the Nigerian people that we are not going to be in power because you voted for us. We are going to be in power because we have other means of overriding you and exercising power. This means they don't have any responsibility to Nigerian system. So I'm saying even if we have a better model theoretically, once you don't go back to that essence of what's the purpose of governance and what types of people are supposed to exercise governance and what should above all be the content of that governance that's serving the welfare and security of the people of the country, then we'll be wasting our time.
Thank you very much. Thank you so much. Now, my dear sister, Obi Ezekwesili, well-known pro-democracy fighter, we both go back and
Thank you very much, Olisa. And hello to all the co-panelists. Olisa, the theme that I was given for this event is called Governance and Optimizing Nigeria's Response to COVID-19. And I looking at it from that very concise interest and weaving in your question on corruption. I think that the very important point to make is that Nigeria's poor governance is correlated to Nigeria's poor governance of natural resource. And natural resource that we predominantly have is, well, at least up to using at the moment is oil. And the poor governance of the petroleum sector could be a proxy for the poor governance of the entity called Nigeria. And the reason is not far-fetched. In the work of political economy of natural resources, we have often seen that the political class of countries where there is natural resources endowment have a fetish for turning governance into a series of transactions that are built around that particular commodity. And so just imagine Nigeria sans oil. We would not be discussing a whole lot of the things we spend our time discussing in our country. Therefore, it is important to identify that until we can get good governance of the petroleum sector, of the oil and gas sector, of the natural resources sector of our society, it is impossible for us to have a political class that would do the kinds of things that Jibo so brilliantly articulated. The leitmotif of government in anywhere, whether poor, whether rich country, is to improve the quality of life of citizens. In natural resources rich societies where the systems of governance of the commodity have not been well articulated, what you tend to see is that there is a complete compromise of the quality of life of the citizens. And so the expert panel of the Natural Resources Charter, Nigerian Natural Resources Charter that I belong to, has spent a lot of time doing some concisive work in the area of better governance of the oil economy. And number one thing that we need to do is that we need to understand that we have to focus on the longer term perspective. The longer term perspective means a future generation perspective. And that we have not done well. And we see that clearly during the COVID. We are not able to, even in the short term, respond to the tension that exists between life and livelihood. And because we did not build for the longer term. And so we're not able to respond to crises such as COVID. So number two thing is there is going to be a next normal that is already upon us. Not even the new normal. There will be a next normal because the series of crises that would follow the new world would mean that health issues are going to be crises that we cannot envisage so quickly, but we must have systems that can respond to them. So the number three thing becomes, how do we optimize the resources of natural the proceeds of natural resources in ways that we translate them quickly to human capital and to critical infrastructure, that is a formation of physical capital that is necessary to provide a basis for your citizens to have quality of life. Number 4 point then becomes, why is it that many decades after and learning the lesson that we must use natural resources in a way that adds value to the economy through diversification of earnings, we haven't done it. We haven't done it because we haven't found a constitutional mandate for ensuring that an arrangement enables a smoothing of expenditure when the volatility of the pricing of natural resources comes upon us. And so constitutional provision has to be made for how we govern the proceeds from oil so that we have it in the way that it is not left to the capriciousness of a political class that has zero incentive to use the proceeds of natural resources for the betterment of the lives of citizens. And my final point before I stop is that for us, the diversification agenda has always been a rhetorical agenda. It's all about the rhetorics of we have to diversify the economy. Now, why is it that the government after government has not succeeded in doing this? It has not succeeded in doing this because the citizens themselves have not created a demand pressure on governments to insist that there is a result that is acceptable. There is a quality of outcome in governance below which citizens will not accept. And to that extent, therefore, when governments don't produce results, there is absolutely no consequence. So it goes back to the issue that with this kind of political class, you need to have very strong citizen engagement that is based on analytical data advocacy to show that we are not governing in the way that we should govern, because we're not focusing on the right policies, we're not building the right institutions, we're not investing in the right priorities that enable inclusive growth that would be beneficial to citizens. So if we don't do this and bring citizens into the center of this conversation, then what would happen is that we're going to meet the next set of crises, and then we would again repeat the pattern of being caught flat-footed. I stop here and wait for any further questions.
Thanks so much, Obi, my darling friend. Thank you so much. Let me remind the participants to go to hashtag capital B, B for baby, capital B, capital D, David, small ANC 2020. It's in the box on the right-hand side of your screen, and take part in the polling that is going on. We don't have much time. I've been advised by the conference director that our time is very limited and I need to go to the Q&A. Some people have sent in questions. So Aliyu, a question for you, sir. Can you hear me?
Yes, I can hear you.
Someone is suggesting that maybe a better governance model would be to reconsider a parliamentary system which is more inclusive. What are your thoughts in a minute?
I think it's too late for us to start from ground zero again, or start all over again. Even though I do like the parliamentary system, but I think what we need to do is just build on what we have already. And since I have this opportunity, let me just echo that it is not all that hopeless. And I want us to, whenever we discuss critical issues like this, to look at the other positive things that have come out, even in the management of this COVID-19. When you take, for example, some of the fantastic, management that is going on in Lagos, consider a city of almost 20 million. And you can see from the governor down to the officials, that everybody is trying his best. Same thing here in Abuja. Since I am the chairman of the ministerial committee on COVID-19 and I left, active government service 13 years ago, I'm re-engaging with some of these public civil servants. I'm really impressed with the doctors, with the nurses, with the, officials. We started from a scratch with no facilities at all in Abuja, but now we have even a redundancy, of bed capacity, because within a short time, we could create, 1,000 beds in less than 2 months, with, different, initiatives going on. So I think we also have to, no matter even if there's small snippets of, progress, we must accentuate that. We must say that some people are doing well, and that is the way to go, and we have to encourage, the good behavior, and then perhaps, discourage, negative or bad behavior. Thank you.
Thank you so much. Governor Peter Obi, a question for you. We all keep talking about the Nigerian problem. What, if you had the opportunity, would you do specifically to fix the Nigerian problem?
Well, I think this is let me just say just follow up from what Aliyu said. I agree with Aliyu that there's this emphasis here. That's why I said that, yes, there might be a situation where you have 10% or even 20 that are doing it the right way, but we need the critical mass of people and everything. Everybody knows what other countries have been able to do in order to be where they are. It's not a rocket science. We were signatory in the year 2000 to Millennium Development Goals. We're signatory to it. China did not do any other thing, neither India. What they did is that they mainstreamed that agenda in their development plan and followed it strictly. And within that period, like I've always said, we're able to pull 439 million people out of poverty. The same thing happened in India. But within the same period, we've been able to put millions of people into poverty. And it's still happening today. There's a follow-up to that, which is the sustainability agenda. We're not following it. And I use my little experience, just very little experience. When I became the governor of Anambra State, on education alone, the first year, we were number 26 on NECO and WAEC. Second year, we were number 25. And I called the commissioner and said, listen, before I leave this place, we must be among the best 10. We didn't go to be the number 1. So whatever it takes for us to be among the best 10, we must do it. We must, since MDG is about fighting extreme poverty, education and health, we must invest in these 3 items, and it must work. Of course, I don't need to tell you what happened because you happen to come from Anambra State. In 2011, 12, and 13, we are number 1, both in WAEC and NECO. And I don't think anybody today can say, in terms of even cutoff point, we remain the highest. In health, similar thing happened. We had a situation where we didn't have no single school of nursing, no single school of midwifery was accredited and functional. But we have voluntary agencies, churches, that have schools of nursing in places where like Iyenu, Boromeo, everything owned by the churches. We went and partnered with them, invested in it. By the time I was leaving office, we have 14 institutions that were in that area because we talk about primary health care and you don't have the people. So you can go on and on, the rest is for you to look about. I'm not saying if I have opportunity, what I keep saying is that we need the quality of political leadership in Nigeria is too low as it is today. No matter what you do, if you get your politics wrong, then it is wrong. What we have today is a case of where lunatics are in charge of the asylum. We need to fix it.
Thank you so much. Thank you so much, Governor Peter. Chief Philip Asiodu, but I was going to go. So, Obi, please, if you stand ready to just sort of like give us a 2-minute, wrap up of what we've been saying. But I must call my uncle to say something.
Just quickly.
Yes.
Following from what Governor Obi has just said, and Professor Jibrin and Aliu, please, we don't need to reinvent the wheel. We must, and I was very sad to hear the centrality given to governance of oil resources. If the projections we had been followed, by now oil will just be 30% contributor to our revenues. Let us please go back to the plans of 70, 74, 75, 80, the Vision 2010. Update it. What is important is to force people, as Governor Diaz said, do the things which have been identified. And in those places, in those 2 plans, started by saying oil was a wasting asset. So people were not going to be concerned with the present process to come and share oil. Let us please go back. The specific projects in agriculture, take it all the way to agro-allied industrialization, education, health, all these things are there. We should please stop making budgets, just making noise. There's so many trillions, nothing identified, no place, not where the projects will be, costing and all that. I think we should go back to the process of hard work, identify what we must do and do it. And eventually, you will find that if we are empowered, you remember before independence, all the farm settlement schemes, the reason farms, these were done by Nigerians, and we can go back to that. We must go back. Be more specific. Identify projects, train people to do it, and let governments agree that these are the important things. Because if you ask anybody, what does he want? Shelter, food, education for his children, wherever he is. Let us please go back to those basics and reintroduce merit, competence, performance, and integrity. This arithmetical quota has done us what it has done to us. And we see that in every sector, we're ill-prepared. But before the next round comes, let us see how we can persuade ourselves to go back to simple hard work. And finally, you remember that in 1962, when they first produced the post-independence plan, Balewa, Opara, Sadwana, all the politicians took 10% salary cut to signal the need for savings. We really have enough money if we deploy it properly. And in some places, I have suggested secretly, I've suggested publicly, what should be the salary structure from president downwards. What we have now is most unfair, most wasteful. So please, when we talk about these things, we don't need rocket science. We should just go back to simple, honest hard work and select and perform.
Thank you very much. Thank you. There's a question for you, although we are really out of time. But the question, says that you are a shining beacon and hope for Nigeria. And I think I agree with that comment. But the question is, do you think there are too many states and that it hinders governance? So I would like you to wrap this around some of the closing thoughts that you have. So, and unfortunately, participants, I'm sorry, lots of questions, very good questions, but there is no time to take everything. But I touched on some of the key ones. So, Abi, can you hear me?
Was that? Is that me? Okay. Yes.
Did you hear
first, I wanted to.
Okay. Did you hear me?
I'd like to say that. The centrality of oil is the creation and design of our political class. They have not been able to think beyond oil as a basis for governance of the country. And so the case that we're making is that if you can move this matter of governance of oil out of the realm of capricious personal design, where any president can decide that he, instead of just focusing on being president of Nigeria, he cares to be governing the petroleum sector. That's rubbish. That's utter rubbish. We should get to the place where we have the system and the structure, the incentive for the private sector. We deregulate that sector, just hive off all of these unproductive assets, because that way we would minimize the interest of a rentier political class in the politics of the country. So that's number one. Number two is that, the level of what satisfies you is the extent of what you celebrate. It's unfortunate that a number of the people in our political class want to celebrate average and mediocrity for excellence. I dare not do that, because we have too many of our citizens that are left in poverty, stuck in poverty, and for a long time are going to be in intergenerational dynasty of poverty. We cannot celebrate as though we have done some great things. I believe that it is urgent for us to use the post-COVID period to simply question everything. We need to dismantle all structures and systems that are not working for us, and we need to create structures and systems that take us into the rest of the 21st century on the basis of the primacy of productivity and competitiveness of our economy as a basis for making sure that we have prosperity that is inclusive and that we can build a stable society. And finally, I want to say that there is no group that has an incentive for the change of this country right now, more than the society at large, meaning the citizens. The citizens must be at the center of deciding what quality of governance we want in Nigeria. The politicians have no incentive to give it to you. The technocratic class in the public sector or in the civil service have no incentive to give it to you. But the citizens who are getting the rough end of the stick can become the collective action that would demand for a conversation around what kind of a structure of Nigeria would be very inclusive, that would provide equality of opportunity for everyone to thrive, for every region to thrive, for every individual Nigerian, whether male or female, whether Christian or Muslim. We need to optimize our diversity, but we can only do that when the citizens take charge of this conversation. Right now, it isn't working because citizens are yet sleeping.
Oh, thanks very much, Obi, for that.
Thank you, Olisa. Thank you so very much. We must bring this session to a close. We have the Honorable Minister for Finance waiting, as well as Professor Collier waiting in Oxford. Thank you so much to all our participants. We do appreciate the time that you have spent for allowing us to watch and to listen to a wonderful conversation. We will now go on to our next session.
Thank you very
so
much.
much. And
Thank
bye-bye.
you. Thank you. Bye.
Thank you so much, ladies and gentlemen. We have two sessions gone already, one on health and the other one looking at governance. In addition to that, we've also had a fireside chat just looking at the readiness of our capital markets to fund the significant rebuilding that we need to do in the years that lie post-COVID. Our next session is on the fiscal response to COVID-19. And this afternoon, we will be having joining us the Honorable Minister of Finance, Budget and National Planning, as well as Engineer Mansour Ahmed, the President of the Manufacturers Association of Nigeria, and of course, Mrs. Ibukun Awoshika, Chairman of First Bank Nigeria, and a big-time business person in her own right. We would also have Professor Paul Collier join us from Oxford University, and as well, we would have Dr. Kalu Idika Kalu, former finance minister, joining us as well. Can you give us a minute or two as we welcome our panelists one after the other, and thereafter this next session will take up. I see that Mrs. Awoshka is on, so is Mansour Ahmed. We are waiting for Professor Collier to join us, and then, of course, the Honorable Minister of Finance, Budget and National Planning.
Hello, everyone. This is Zainab Ahmed. I've joined the meeting.
Honorable Minister, thank you so much and welcome. Professor Collier, we also see that you have joined us from Oxford. We welcome you warmly.
Thank you.
Thank you very much. So we will start this session immediately. Professor Collier, you recall when we spoke at the weekend, we have never spoken about health scientists in Oxford in all of our conversations, but you will remember that that underlined our conversation, and it just demonstrates the time that we are all in all over the world. I will be starting, as you would imagine, with the Honorable Minister of Finance. And Madam, I welcome you very much and indeed congratulate you for the great work that you are doing, your very steady approach to managing what is a very, very difficult task at a time like this. And I must commend you. I know that our audience will have a lot of questions, but I'd like for you to kick off this conversation By just speaking to the audience for 10 minutes, Nigerians here and in diaspora, investors that are watching from here and from abroad as well, where exactly are we in terms of the fiscal shape of Nigeria today? Madam, you will sing, you are muted.
Okay, let me thank
Great.
Business Day for organizing this, and also thank you again for allowing me to share the space with Sister Ibuku Awoshika, Mr. Paul Collier. Hi everyone, Dr. Mansour, and Engineer Mansour, sorry, I always call you Doctor because there's another Mansour Ahmed, and everyone that is here today, not least of Dr. Odisa Ogadiba. I see also Big Sister Obi Ezekwesili is here. Good, it's an excellent panel. Well, where we are today is that as a nation, we found ourselves, just like everybody in the world, in a global health crisis that has very quickly snowballed and become a global economic crisis. The effect for the world is far-reaching, but also so is it for Nigeria. The pandemic has helped us to take a very critical look at our health infrastructure, even at the economic policies guiding our health. It has also helped us to fast-track some key economic reforms which were difficult for us to do so. Because of the decline in the crude oil price, it became easy for us to pull out fuel subsidy. So we used this opportunity to exit from fuel subsidy. We're also on our way to the path of exiting fuel subsidy as soon as there is improvement in the health crisis. That is one major target we seek to achieve. We also had an opportunity to critically look at some of the key development projects that have been going on in the oil and gas sector. It gave us an opportunity to look very closely into the cost of operations of the oil and gas sector in Nigeria, which is reported as one of the highest in the world today. So it helped us to look at reforms that needed to be implemented. Currently, we're looking at how to right-size government by doing some alignment of government agencies and departments. We're able to further deregulate the exchange rate, moving from an official rate of 305 naira to 360 naira. We're also on the journey to merge into a single exchange rate, but it's a process. But we made a commitment, and we're going to get there. During this period, we were able to now get the whole of government, and that is the federal government and the state, to step back and take stock and rationalize expenditure. At the federal government level, we're able to review our budget, cutting out expenditure that could wait for a later period to enable us accommodate critical expenditure that is required, especially for us to be able to adequately respond to the pandemic. Gladly, we have a parliament that has been very, very cooperative. Just Thursday last week, they passed the amendment to the budget. A week before then, 1.5 weeks before then, they passed an amendment to the MTEC. This is now allowing us to actually be able to vigorously move ahead with implementation of key government programs and projects that are required to reflate the economy. The president had directed that we must make sure that we concentrate on implementing major priority projects, the key signature projects of government, such as the development of rail, major roads, bridges, power. And we're able to do that because we have had the cooperation of development finance institutions such as the World Bank. The IMF has already provided a rapid financing facility to us, which has already been disbursed. So we have resources to be able to do these projects. This will help us to reflate the economy. We also have just concluded and handed over and published an economic stimulus plan that has a suite of initiatives that are meant to create economic activity by creating jobs and also providing palliatives not only to the poor and the vulnerable, but also to the very small and weak businesses that are in the sectors that are more heavily impacted by this pandemic. It's a 2.3 trillion naira economic stimulus plan. I hear issues being raised is small for the size of the Nigerian economy, but it's what we can do for 2020. And we need to do a plan that we're able to fund by government revenue as well as by raising funds from development partners and multilateral institutions. Come 2021, we're starting the work on the next MTEP. We will be looking at how we can expand this stimulus package. We have a suite of incentives that we're working on. Some of them already encapsulated in the Finance Bill of 2019 that was signed up first on the 13th of January. The Finance Bill provided relief to small businesses by zeroing taxes for them. So we have businesses in Nigeria today whose turnover is 25 million naira and below that are paying no income tax. So their income tax is the company income tax is zero. And then the middle category, 25 million to 100 million, have a reduced tax rate of 20%. We're also looking at how to provide tax relief for businesses that are not within these first two brackets by either deferment of taxes or by deferment on a one-off basis to provide relief. The essence for us is we're trying to encourage businesses to keep jobs so that they don't downsize, to maintain production so that they don't have to stop productive activities, to help to continue to drive economic activities. There's special attention that is being given to the service sector, especially aviation, the hotel industry and such that they also are able to come back to operations and manage at a level that enables them to retain jobs. We will be going to the market, the Nigerian capital market, to raise funds. We have already done that earlier in the year. Even last week, we closed out on a Sukuk bond. We set out to raise $150 billion US. So the Sukuk bond is meant for building of roads, specific roads across the country. The turnout was about 650 billion, which means there is a large appetite in Nigeria, and also there's a large capacity. Investors in Nigeria are actually looking for instruments, long-term instruments to place their funds, and we're designing these instruments. Some of these instruments will be designing them specifically to be able to give space for pension funds that have long-term money to have instruments that match their investment appetite, so that they can invest also in infrastructure bonds that are Naira denominated, protecting pension funds from exchange rate risks. Let me stop here at this time.
Thank you very much, Honorable Minister. We will be coming back to you. Thank you. Let me now direct my next question to Engineer Mansour. You have run some of Nigeria's best refineries. When you were in government, you were the pioneer head of the Infrastructure Regulatory Commission, and now you are in the private sector leading the Manufacturers Association of Nigeria. Clearly, these pandemics, the health and the economic ones, have ravaged businesses across the country. What are you hearing from your members in terms of what government should be doing for them? How are they and their businesses being affected, and what do they want the government to do? I'm sure the Honorable Minister is listening.
Well, thank you very much, Frank. Good afternoon, Honorable Minister, distinguished ladies and gentlemen. I think the first initial reaction of members of the manufacturing sector, and I dare say most of the industrial sector, is anxiety. Anxiety because we are in a situation where we do not really have all the answers, and we cannot predict where we are headed. I believe that this is, of course, common for almost everybody, not just in the country, but in the world. Because this COVID pandemic is introducing new indications that people are not familiar with, that people don't know how to predict, and therefore I think we are bound to be anxious. But we are also anxious because of our experience with the public sector economic governance in this country. And indeed, the Honorable Minister just said that they are taking advantage or taking the perhaps leveraging on the COVID pandemic and the current situation to deregulate the downstream petroleum sector. Now, that indeed indicates the kind of problem we're facing, because it seems that this policy is ad hoc and opportunistic. But should economic policy be ad hoc and opportunistic? Should it not be based on a planned and clearly defined trajectory for development? And I think that's where we're starting to have a problem. When people are not philosophy governing economic policies, what is the philosophy governing even social policies? Every change creates anxiety, because then you don't know how government is going to react. So this time we're happy that, okay, government is taking the advantage of COVID to implement a policy that, as far as I know, and you just said correctly, Frank, that I've been in the oil industry for over 15, 20 years. And I know that the issue of deregulation of our oil industry has been on the books since before 2010. One of the major recommendations for Vision 2010 that we should have by now a totally private sector driven, market driven oil sector. And if we had done that, I believe that we all know our oil sector, our oil industry will be totally different from what it is today. So I believe that's the first instance, the first feeling of our people of anxiety. How will government react? What will be the consequence of these reactions on our industry and our lives? And whatever reaction, whatever way government reacts, is it going to be sustained? Because even as other ministers said they are going to deregulate the industry, the downstream sector, our question is, for how long? Is it going to be deregulated just for as long as there is no other change in the oils in the oil market, so that we are seeing $50, $60, $70 per barrel oil? And our experience has been in the past, this has happened. That when the oil industry goes down, we talk about deregulation, we talk about integration, we talk about all sorts of policies that we know we should implement in our country. But as soon as the situation changes, somehow we lapse back into our comfort zone. So that's the basis of the first anxiety, that's the basis of the anxiety that our people felt when COVID struck. And of course, beyond anxiety, we also felt worried and concerned, because we know that our industry is already a fragile industry. The manufacturing sector in this country, it has been like that for ages, since we abandoned effective, diversified economic planning. Our manufacturing sector has deteriorated and suffered, largely because we have concentrated on the mono economy. Government has literally cut itself from basic economic responsibility because it has oil. Government has simply abandoned planning the balanced economic growth. It has abandoned the need to ensure a balanced socio-economic structure, because government does not need other sectors, it has oil. So I believe that the first thing that we must recognize this COVID has done is to bring it home to us, that government must, and I think this has been highlighted in the earlier session, government must go back to principled development planning. And that development plan must be based on a philosophy of economic development that we must accept and own. It must be based on a philosophy that agrees with the situation we are in, agrees with the state of our economy, agrees with the state of our democracy, agrees with the state of our demographics. Because if we don't do that, we'll continue to go around in circles.
Sure.
That is why the manufacturing sector has been so fragile and so unresilient. Every time there's a major shift, every time there's a major crisis, the manufacturing sector and many other sectors collapse. And we have an economy that remains so unresilient that we fear the next change in oil price or the next change in commodity prices, or even the next change in government.
Yeah, that's right.
So I believe like that is the initial thing. However, I believe that apart from the anxiety and the feeling of concern, there is also the recognition that this pandemic has impact not just on our economy, but on our health. And I believe that as employers of labor, we are also concerned with the health of the people that work for us. We are also concerned with the health of our communities. We are also concerned with the health of our families. So what then does this present? It presents us with what I think some professor, I don't know if it is Professor Kolia, called binary choice failure. One way or the other. Whatever we choose, we're not sure that we shouldn't have chosen the other one. Are we going to look after lives or after livelihoods? If we look after lives, yes, of course, we may save lives only for a while. And then, of course, the lack of care for livelihoods becomes a threat to lives. And I think we are now beginning to see, not just in Nigeria, but everywhere else, that this is a balancing act. It's like somebody who had both high blood pressure and diabetics. You have to try to manage two, because if you just focus on the diabetic, you lose them through high blood pressure. If you focus on that pressure, lose them through diabetic. So that basically is the initial intention. However, we in the manufacturing sector recognize this right from the beginning. And we believed and felt that it is absolutely important that we engage the public sector and particularly the relevant actors in government direction. And indeed, we're happy that this is what we did, because since the beginning, I think sometime the middle of January, we have engaged government at different levels. First, we engaged.
Okay, Mansour. I'm going to come back. I'm going to come back to you clearly, and I can feel your pain. I mean, all those years in the Nigerian Economic Center, Nigerian Economic Summit Group, all the discussions and all the work done, and as you recall, in Vision 2010 as well. There is absolutely no way we would have imagined when we were in Vision 2010 that today in 2020, Nigeria will still be where it is. Let me go to my sister, Mrs. Ibokun Awoshika. I welcome you very warmly. You're chairman of one of Nigeria's biggest financial institutions, but you also manage a large business yourself. Can you tell us how different this crisis has been and how businesses like yours are coping?
Thank you very much. Can you hear me? Can you hear me clearly?
Yes, we're hearing you.
Okay, thank you. Thank you very much for inviting me, and thank you, Honorable Minister, and my friend Mansour, for what you said. I think I've spent the last 31 years building the Chair Center Group, which is manufacturing, a company involved in manufacturing in the furniture and security systems industry. And there have been different seasons, obviously, in a period of 31 years. But I guess the most recent for Nigerian manufacturing companies would be when we had the recession in 2015, 2016, and the attendant impact on our businesses in terms of the fact that there is at least about 50% of our input in our production that is sourced internationally. So anytime you have a major situation that impacts on foreign exchange rates and moving of goods back and forth, it would impact on your production essentially. And
Sure.
then obviously, in trying to protect our foreign exchange earnings as well, the country has continued to regulate the products that have access to the foreign exchange in terms
Yes.
of getting the raw materials that is required. That's a different story in itself. But when you think that a lot of the manufacturing companies that suffered one thing or the other over 2015, 2016, 2017, started settling down in 2018 and 2019, you know, and 2020 was meant to be like a cap of restoring companies back to normalcy as things started picking up. Because the market was quite slow in picking up to pre-recession periods. And then all of a sudden, we find ourselves not in a situation that can be compared to 2015, 2016, but worse in the sense that it's a global situation.
Yeah.
You had no area of recourse. You had no alternate market options that were giving you some sort of relief. Everybody was going through the same thing. And for the Nigerian manufacturing sector, it's a double whammy in the sense that, don't forget that just before we went into the pandemic, because the oil market tanked in a sense, we were already quite stressed in terms of our foreign exchange earnings.
Yes.
And ultimately that had affected rate. And so when you have a loss of value that was, you already had about 15% or so to deal with in terms of cost of some of your raw materials. And then you get to a point within the same cycle that your market literally shuts down. You have hundreds of workers or thousands of workers, depending on the industry you're in. You have salaries, you have people, you have overheads, whether you run for 1 second or you run for whatever amount of time. There is no negotiation of those facts. So in reality, that's where a lot of manufacturing companies like ours are. Your customers, and it's not just about your industry, it's about every single industry, which means even though we're opening up now, and you're opening up a little at a time, your customers are also depressed. So you have issues of receivables. All the customers who need to pay you money have COVID as a perfect excuse. And it's reality. You can see the market. You know what the issues are. So your customers are challenged. They can't pay. Your customers are challenged. They're not making new orders. New businesses are difficult to come by. Everybody's philosophy right now is to preserve your cash flow.
What they have.
Preserve the cash that you have. I'll tell you, there was a study done by Faith Foundation of recent, and it covered almost 2,000 medium, small, and of micro, small, and medium-sized companies in Nigeria.
Yes.
And part of the report says that only about 47% of almost those 2,000 businesses that were interviewed had cash to cover 90 days. You had about another 20 something percent that had cash to cover maybe about 7 to 14 days. And then you had this large group of the others who only had cash for between 1 to 7 days.
Wow.
Now, what is, because really, if you look structurally at how our financing is done, a lot of businesses are dependent on their daily cash flow.
Sure.
There are those that are big enough to have access to financing from the institution. It's good to listen to the Minister of Finance talk about all of the different plans that they have to help reflate the economy by providing capital for businesses at different levels. So it shows that they themselves recognize the problem, and government is proactively trying to find a way to solve that. The challenge is always that there's always so much focus on the micros and the small. And there are many businesses at that level, but there are many businesses at that level that are subsistence level businesses. And then you have from the small to the medium, who are the bigger businesses, who are the real employers of labor. And this is where the jobs that we need to protect, this is really where they exist. But that's the group that we traditionally typically think they should be okay, or they should be able to get money from their banks. Now, luckily I sit on both sides of the, I have the unusual opportunity of sitting on both sides of the table. And in reality, people tend to forget that banks are not national institutions. They're not government owned. They are business institutions. And the responsibility of the financial institutions is to make sure they run efficiently and generate profit for their shareholders and their and create value for their stakeholders. So, of course, we cannot exist in a vacuum. The economy and the nation must work for our businesses to work.
Yeah.
And therefore, the banks traditionally will always work with government and with a very strict, tight regulator, setting the pace of how the banks are engaged in the process of supporting government to achieve this. You know that the banks will always play their own role. But even with that, they still have a responsibility to ensure that they do not go on a party in terms of giving out loans and then run up NPLs that, if you look at a country like Egypt, part of what their government announced of recent is a $5 billion bank guarantee to support businesses taking the loans from the banks, which means that, you see, walking through the bank, finding a formula that allows us to use the commercial banks to support the government in a way to support the businesses, but understanding the fact that the banks themselves are a business and creating some sort of security for them behind the scene is far more interesting and helps us to more effectively reach the businesses than if we're running a grant or a government policy. Because then a lot of arbitrage.
So would you suggest to the Honorable Minister to examine that bank guarantee model, as a way forward?
I think without a doubt, for a lot of the things that the Honorable Minister has said, which are very positive things that will support the business environment, there needs to be a partnership between the banks and the government, and to find the most efficient way to use the resources available to government, using the infrastructure and the resources of the banks as well, to achieve the most that we can in order to reflate the economy of the country and help the businesses to remain. So we can preserve jobs, we can grow the economy, and we can add the value that we want to create for our people.
Thank you very much. Thank you, Madam. We're going to come back to you, and I'm sure the Honorable Minister will respond to this Egyptian model. Professor Collier, thank you so much for joining us. And let me say that we welcome you warmly, and would like also, even if belatedly, to congratulate you on the knighthood by the Queen. There are those who say that Nigeria was already, or the economy of Nigeria was already in trouble before the pandemic. I mean, you, more than many other people or many other economists, watch the economies in Africa very closely. What are you seeing, and where does the situation in Nigeria diverge from what you are seeing elsewhere on the continent? Professor Collier.
Well, first of all, thank you very much for inviting me back. I'm very conscious that I'm an outsider, and there's very limited things that an outsider can contribute. You know your own society much better than I do, right? I'd also I want to congratulate the finance minister on a very sophisticated presentation, right? Many European finance ministers wouldn't manage as sophisticated a presentation as that, I can assure you.
Thank you.
Europe's record is not very distinguished in this crisis. What we're looking at, the animal we're looking at is what's called radical uncertainty with COVID. The right answer to the question, what should you do, is we don't really know, right? And if you don't really know, we can't really know, there's two big principles. One is learn as you go. So be prepared to experiment, to try things. Don't think everything will work. No? You'll have to learn as you go and be prepared to error correct. There's no perfect here. There's just learn from trying things. The other is try and avoid things that you will really regret, or you may really regret. The one big message that I would have to the finance minister, that I think she's already very well understood it, is don't miss the chance to reset the national narrative. Previous governments, as has already been said on this, previous governments did try and kick the can down the road in the hopes that the oil price would come back up again, and that missed an opportunity for fundamental change. The shock that you've been hit with, I think, is it's worse than usual because it's global, but it's a shock which I think is going to be pretty persistent. The fall in the oil price, I think, is not going to recover anytime soon. I think for 3 years at least, we're looking at low global commodity prices and a pretty hostile environment. So I think this time it is different in the sense that it would be really dangerous banking on the proposition oil prices will go back up to $70 within a few months and we'll be all right. I think this time that's very unlikely to happen. And that leads me to the importance of resetting the narrative. And what is the new narrative? It's a shift, the fundamental shift that Nigeria has needed for so long, which is to move resources away from rent seeking into production. And rent seeking means getting money from government in various ways. Production means predominantly for the domestic and for regional markets. You can do some things for export, but the export market for everybody is pretty hostile at the moment because of this global recession. And so, but you've got huge scope for increasing production, both for the domestic market and for the regional markets. So let me talk about a few, first that idea of the push towards increasing production. And first, the fundamentals. All production of any scale and productivity needs two things. It needs good connectivity and it needs good electricity. And for years, Nigeria didn't have adequate connectivity, the transport system, and it's never quite fixed its electricity provision. And now is the time for that. Those two fundamentals. Without those fundamentals, you can't get serious production by serious people. They're trying to work with their hands tied. And then let me look at three new opportunities for productivity. Really, one is food. It's frankly ridiculous that Nigeria imports so much of its food. It's a huge waste of foreign exchange to be importing so much food. Nigerian agriculture productivity has been pretty well stalled for decades. So a big push to both growing more and processing more, agro-processing of food. There's huge losses from between harvest and the dinner plate, huge losses, and something like 40% of the crop rots in the journey from the field to the meal, and that's where processing of food comes in, agro-processing, because when you process, you increase storage lengths, because basically what you're doing is removing water content. So huge scope for food. It's a very big sector. It could create a lot of new jobs. And it's something that with the shortage of foreign exchange, which is going to be there for quite some time, you need to look at things where foreign exchange is being spent needlessly. Second big area for opportunity is housing. Most Nigerians are really badly housed in single-story shacks, and so igniting a proper, affordable house building program by small construction firms, so a private sector process of providing housing. What's holding that back? I think two things which are eminently fit. One is urban land rights. People are not going to build until they've got secure and marketable title to a plot of land. And you just have to drive through Lagos and see the signs painted on houses, "This house is not for sale," and that tells you, that tells you at the moment land rights are not secure, right? So sorting that out once and for all. I hate to hold up an example elsewhere in Africa, but Rwanda did this. It took less than 3 years. It cost $6 a plot to get land registered. Ethiopia managed to do it for $1 a plot, right? I used to work for the World Bank. Don't bring the World Bank in for this. The World Bank advised Tanzania, and it cost $3,000 a plot because too many lawyers, all the lawyers, right? So you can do this fast and simple, and it makes a huge difference. Once somebody's got a legal title to land, they can afford to build a proper house on it. And what's more, that proper house and that plot of land can serve as collateral with a bank. And you need to ignite a mass market mortgage industry. And I mean mass market. In Britain, all the British cities of any note, my own city where I grew up, Sheffield, they got built in the first half of the 19th century. Britain started the 19th century a rural society, ended it a very urban society. The housing got built in the first half of the 19th century when incomes were still very low and people established building societies. There were mutuals, they were very cheap to administer, and they provided mortgages for really quite poor people. And that transformed housing. And it created a huge amount of jobs because building affordable housing is very, very labor intensive. It's a lot of jobs.
Yes.
So that's a big, big opportunity. Land rights and mortgages. Those are that's the sequence, right?
Yes.
Then the third thing to do is develop clusters of firms that have some sort of common sector expertise, and so they help each other. My favorite example in the world is these things on my shirt, buttons. 2/3 of all the world's buttons come from one city in China, which 50 years ago was a fishing village. And it's not that there's one big, it's not that the mega button works there, it's that all the little button firms congregate there, because by being all together, they bring each other's costs down. You get a skilled pool of labor that knows how to make buttons, you get all the service industries. And so building these clusters is something that can be done, and it can be done at local government level. You're lucky that you've got this state level system with state governors. State governors need to be developing economic strategies for clustering production, new activities. Let me give you one example from Britain, because I'm working on trying to revive depressed regions in Britain.
Yes.
And yesterday I was working with the government of Liverpool. And Liverpool used to be a very thriving place, and then it went through economic ruin, and now they're trying to bring it back. And so they're thinking, what can we do in Liverpool? What can Liverpool get specialized in? And they've got three ideas. One is they're making their universities work with local firms in sort of business parks to develop a cluster working around health sciences. And they've managed to get a very senior executive of Google, who was born in Liverpool, to come back. Now,
interesting.
And he's building that. Now there are brilliant Nigerians all over the international business sector. You know, now's the time to say we need you back home. You know,
precisely.
So that's an example of a cluster. What else is Liverpool famous for? Football. The Liverpool clubs have got 600 million fans worldwide, right? And so that's a huge tourist thing, right? Well, Nigeria's pretty famous for football. The other thing Liverpool's famous for is music, the Beatles. And so it's developed a big tourist industry. And the finance minister was quite right to talk about protecting the tourist industry during COVID. So these are just examples of a depressed local region developing an economic strategy based on these are the things we're going to try and develop as clusters. Let me turn from that very briefly, and please feel free to shut me up at any time. I've overstayed my welcome. But I wanted to suggest a few things where you're going to.
I will give you one. I will give you one or two more minutes.
That's fine. There's some things you need obviously to shrink, and one is public sector jobs, another is public sector contracts, and a really important thing that I think I heard the minister talk about was foreign exchange. You're going to have less of it. It's really damaging if the central bank starts to allocate foreign exchange through multiple exchange rates and patronage. Been there, done that, it leads to a big corruption industry. And so unifying the exchange rate around an exchange rate that works for everybody, that's market clearing, that's really, really important. It will also improve government finances because you're a net seller of foreign exchange as a government. And so it will automatically finances.
Thank you so much. Thank you so much, Prof. If we have time, we will come back to you.
I finished. Thank you.
Let me ask the Honourable Minister to respond both to the points that you have made about the key three areas of priorities: housing, food, and creating a clusters of firms, and of course to the point that Mrs. Awoshika made earlier about adopting the Egyptian model of the government providing credit guarantees so that banks can easily lend to businesses. But before she comes, let me take the absolute pleasure in congratulating her on her birthday today. Happy birthday, Madam Minister.
Yeah, I was going to unmute myself and went off. What a nice surprise. Thank you very much. I'm 60 today. It's a special age. It feels nice to be 60.
Congratulations.
Yes, for that. Thank you very much. But just permit me to say to Engineer Mansour that, okay, a lot of things have been done in terms of planning before, very good plans we've had over time. A lot of the plans not implemented. But one thing I've learned over time is never waste a crisis. And this is a crisis that is a global one, and we are doing the best that we can. Like Mr. Paul Collier said, is, do you really know what to do? Not really. You just take one day at a time and you keep adjusting. When we started, we were going to revise our budget. We started by $30. We went down to 25. We went down to 14 because it kept changing. So you have to keep changing as things go. And to my sister, I really want to see this research. It's very interesting that this research of 200 companies that provides cover for 90 years. And you're right. Most of the time in government, when we think of support to the private sector, we're thinking of the smallest of the businesses. We do need to look at the medium-sized to large businesses because they also are large uptakers of labor. We have very good partnership with the bank through the instrumentality of the central bank. The banks have worked with the central bank to provide low-cost funds, to provide some relief in terms of borrowing by extending repayment periods and even in some cases standing down some repayments. The central bank on the other hand granted some forbearance to allow the banks to do that. So we do have a partnership. Is it in the best of form? No, it can be better. So we need to continue to work more. And what did you say about creating a guarantee? Nigeria is a member of the ATI. This is Africa Trade Insurance Corporation. We had a meeting with them this Saturday. We're looking at how we can work with them to actually make the insurance guarantees that they provide more visible for uptake by Nigerian businesses. There's an agency that is called NISRA. It's an agency under the Central Bank of Nigeria. What they do is just issue guarantee instruments for borrowing to small businesses. Largely, the borrowing is to the agricultural sector. There's also infrared, which is private sector. We're trying to strengthen and grow the partnership between infrared and the Nigerian Investment Sovereign Authority. It has some holding in that. We're trying to see how that can be expanded even more. The view for us is we needed to create special instruments, especially for long-term debt instruments that we're trying to develop that will attract institutions like the pension funds. Mr. Paul Collier, I hope you will be able to, or maybe I'll share with you our the just released economic stimulus plan. In that plan, we had anticipated, we have provided for mass housing as well as an expansion of the agricultural value chain. The focus is not just to provide housing, but to create jobs for small engineering firms, architectural firms, young people, firms that have membership of small membership, 3-5 members of a collection of specialized. So what we want to do is to build 300,000 housing units in this 12 months plan, and it's going to be allotted to 5-10 houses to small businesses. That and the design for us is that on site you will have set up workshops of carpentry, welding. Our target is to use as much as possible made Nigerian raw materials inputs, except where we can't produce Nigeria. We will not be using imported items for the housing. But for the agro processing, there's a program that we call the Green Imperative. We already have a partnership with the Brazilian government, and this is something that has been work in progress for 2 years. It's just been gotten to the point now when we're going to get the final approval. It is a combination of assembly of manufacture of tractors, processing of food, as well as processing centers that are close to the businesses, so that a farmer does not have to own a truck. He can actually lease. So the manufacturers, 6 assembly plants have been identified. They will be given equipment that they will assemble, and then they will now lease to a set of leasing companies that are being registered. These leasing companies are to provide time for farmers to be able to use tractors to enhance and expand their farming. Then the processing centers are there will be aggregators that will take produce from small farmers, aggregate it, and process the foods. Our target is that even as we export maize to our neighbors in the region, that we should be encouraging the export of milled maize instead of the raw maize. So we're trying to add value, and in the process, a lot of youths are being encouraged to join the farms. We're working with the states. The states are providing the land. They're creating this cluster of people so that common services such as tube wells are taken to them, power where it becomes necessary, so that they all have reduced costs. Input will be provided to them, good seedlings, the right level of fertilizer in this large cluster of farmers. And there are these off-takers that will take and then process and either sell locally or for export. So that is what we're doing in terms of agriculture. And also the opportunity that you said we have, which is also provided for COVID-19, is to enable us not just feed the nation, but also feed our neighbors. So there's a huge export opportunity that we want to encourage businesses to take advantage of. Not everything in the government economic plan is going to be funded by government. So like I said earlier on, it's 2.5 trillion, 500 billion will be funded by government in 2020. There's another 430 for the early part of 2021. But about 1 billion of that, 970 billion of that is financing from the banking sector, low-cost financing. In the case of agriculture, we said, okay, we're even going to subsidize the interest rate so that you get as much as possible, an average of 5% interest rate. So that's what we're doing, and we recognize that we cannot succeed if we don't have a very close partnership with the private sector in this. We also cannot succeed if we're not able to use technology to be able to identify the companies and the people that will be beneficiaries and keep a database of them and be able to track the performance of their businesses as we go along. Even in the social investment program, the palliatives we're using, we will not be paying cash anymore because that is a lot of headache. We're going to be using transfers, using BVNs or telephone numbers of people to be able to reach the poor and the vulnerable that actually cannot help themselves. You're muted.
Yes, thank you so much. Thank you. Thank you. Thank you. We are running out of time, so I'm going to give my panelists a minute or two for some closing remarks, and then we will come back to the Honorable Minister to close the session by answering 1 or 2 questions from the public. Mansour, I'll take you, and then take Mrs. Awoshika, and then, of course, Professor Kohli. 1 or 2 minutes, please.
Thank you very much. Well, I'm very delighted with Professor Kohli's submission that we should take the advantage of this to change the narrative of the Nigerian economy. And I believe that one of the key things we have to do is to actually look at the linkages between what the Honorable Minister has said they are doing in agriculture, which is extremely good and extremely pleasant, with industry. We must strengthen our industry. We must create a resilient industry. If you look at our industries today, the only one industry that perhaps we can say is resilient, is international, and indeed is strong, is the cement industry, because we've taken the trouble to link that back to the mineral source and actually create a strong and sustained value chain across the industry. I think we need to do that in key sectors so that we build the resilience that will take us through the next, if you like, crisis, whether it's oil crisis, financial crisis, or indeed health crisis. I believe that in this context, some of the things that we have discussed with the governor of the central bank and the minister of industry to do with looking at opportunities for backward integration, opportunities for export promotion in terms of looking at those industries that have the opportunity to export, like the minister has said, and opportunities to grow the small and medium industry. I believe we must not, even though, yes, in terms of employment, the big industries appear to give us the opportunity for him. I think the churn of business, the churn of economic activity is largely dependent on the mass of small and medium industries that will create the increasing dynamic economic activity that we need. I believe
Thank you so much, Mansell. Thank you so much. Mr. Woshike.
Okay, I'd just like to comment about what Professor Collier said about the clusters. Yes. And I always feel sorry for the federal government, because at any point in time, the federal government in the country is the one that takes the flak for everything that goes on or that doesn't work well. Yes. But like he said, he's working with Liverpool. Now, the real takers who can make the difference in terms of making the clusters work are the states. And because those are projects that are local to regions, to states, to cities, to towns. And unfortunately, because we have a lack of continuity of government, if one government is in and they understand what you're talking about, when the next one comes for all sort of interest, things get shut down and they don't move things over. These are not new things. A lot of Nigerian reports that have come out of the Nigerian Economic Summit group or different kinds of groups have had this there. I have personally invested hundreds of millions trying to set up a furniture cluster between Ogun State and Lagos State and all of that. And I lost hundreds of millions of naira because of some of the, that's just the reality. Because you need people who are industry cheerleaders. People who understand each specific industry. They're the ones who can see the opportunities for the clusters within that industry. And if the private sector is not empowered, supported, or equipped, or facilitated to do what he needs to do, if government keeps thinking, and now I'm talking about state governments, if they keep thinking about where their value is or allow politics to come into it, it will never take off. This is the real challenge with this. So we need, I don't know how we'll solve this, but that's something we need to do, but that's a problem we need to solve. Thank you.
Thank you so much. Thank you. Thank you. Professor Collier. 1 or 2 minutes, sir.
Thank you. Yeah, I think it's all very encouraging because we're all on the same wavelength. And if we're all on the same wavelength and the Nigerian population can get on the same wavelength, then change will happen. And the central message is change is reassuring. The key role of government is to inform and guide and reassure. But the reassurance can't be nothing's going to change. The reassurance is we've got a strategy, and that strategy we'll revise as we go because we don't know everything yet. But we've got a strategy which, as we implement it, we will all be much better off. We'll be doing now things we should have done years ago.
Thank you so much.
If I could,
please,
I'll close there. Actually, yeah.
Thanks, Prof. Thank you, Prof. Honorable Minister, there's a question that I have from a participant upfield, and I would like you to close with this. They wanted to just know how well you are providing for the funding of the Sustainable Development Goals.
Oh, okay. I think I mentioned this earlier on. It is a fact that the SDGs will see a setback globally, including in Nigeria, and we have to prioritize funding for education, for health, and as well as water and sanitation. In the 12 months economic sustainability plan, there is significant funding for health, for education, as well as for water and sanitation. So yes, we have some setback, but we are reprioritizing because we have to make sure that Nigeria's Human Capital Development Index improves. Right now, our rating is really very low compared to other countries that are our peers and comparators. So we're doing our best to make sure we take stock of what we need in terms of being able to stay on course to meeting the SDG goals. About 2 weeks ago, the UN organized a summit for presidents. There were about almost 70 presidents. Our president was there. It was almost a 6-hour conference. And the discussion is, how do we reset our path so that we come back to the right trajectory to make sure that the SDGs do not take too much of a back step in view of the present economic downturn that we have globally, and also the huge expenditure that we have to all undertake to improve on health.
Thank you so much, Honorable Minister. And once again, congratulations on your birthday. Professor Collier, we thank you for joining us from Oxford. Mrs. Awoshika, thank you very much. Engineer Mansour Ahmed, we appreciate the time you have spent with us. I think we will bring this session to a close so we can give way to the next panel. I can see Achaleke, Charles Robertson, yes, members of the other panel are already taking their seats. Thank you so much, and God bless you all. Bye-bye.
Thank you, everyone. Thank you.
Thank you. Happy birthday again, Honorable Minister.
And
happy
birthday, Honorable Minister. I'll call you sister. Thank you very much.
Bye.
Thank you.
Happy birthday. Thank you very much.
Enjoy your day.
Thank you.
Thank you very much. We've come to the end of the third session for the tenor panel for today. We're moving on to the fourth panel. And just briefly before I introduce the fourth panel, I would like to just mention, just wrap up what was the highlight of the this session with the Honorable Minister, Professor Collier, Mr. Engineer Mahmoud, Ahmed, sorry, and then Mrs. Ibukun Awoshika. I think three things pop out, that this crisis offers a chance for a new narrative about Nigeria and the way forward. And it's a crisis that must not be, it must be a crisis that must not be misused. I think it's a great opportunity. The crisis is an opportunity to renew, to change the narrative about Nigeria, and to think about more clusters at the state level, manufacturing clusters, think about mass housing, think about agriculture. And I think the speakers were all on the same wavelength, and even our participants also seem to be on the wavelength. And though most of them are in support of removal of the fuel subsidy, very few of them are still doubtful about government's plans to restructure. They are doubtful about, they think the government is overborrowing, which is why it's comforting to hear that the finance minister is thinking about encouraging clusters and encouraging the private sector through partnership with the banks to encourage small businesses. And as well, they're also very, very confident that the way out of the crisis is for Nigeria to export. So we could say there are a lot of agreements there, and then we'll move on to our next session. For our next session, I'll be handing over to Dr. Oho Okiti. He's the MD Business Day, and he will be handling the panel on the global economic crisis, how deep it is, and how protected it will be. Dr. Okiti.
Yeah, thank you very much, Tayo, for that introduction. Warm welcome to our audience here in Nigeria and wherever you're joining us all over the world. My name is Okiti, and I'm the Managing Director of Business Day Media Limited. And I'll be moderating this last and final session for this for today and for this afternoon. As Tayo has said, the focus here is to look at how deep and how long we think the economic recession will be. And I can assure you, and I have no doubt in my mind that there is no panel better equipped to look at this issue and the dynamics. So let me introduce the panel to you in alphabetical order. I have Achaleke joining us from South Africa. He is the chairman of McKinsey & Company, He oversees the work of Mackenzie in the continent from South Africa. Archer, you are most welcome this afternoon. Good to see you.
Thank you. Thanks for the invitation.
Yeah, thank you. And we also have Charles Robertson. Charles Robertson is the Global Chief Economist for Renaissance Capital. He's based in London. Charles, welcome to this conversation. And we also have Sutura Aisha Bello, and she is the public-private partnership component lead of the UK Nigeria Infrastructure Advisory Facility. That's NIAF, based in Abuja, the capital of Nigeria. Sutura, you're welcome to this conversation.
Thank you for having me.
Yeah, thank you. And of course, the last, and of course not the least, I have our Statistician General, Dr. Yemi Kale, who is also the head of the Nigeria Bureau of Statistics. Dr. Yemi, you are welcome to this conversation.
Thank you for inviting me.
Yeah, for the audience, this promises to be very exciting. So let me just give this instruction ahead. If you want to ask any of our panelists any questions, please go to log on to your Slido and with the code hashtag BD, that's BD in capital letters, ANC 2020, and you'll be able to ask your questions. Please indicate whom the question is for. So very quickly, we have just about an hour for this program, in fact 50 minutes, so I'm just gonna go straight. I would like to encourage our panelists to please answer the question in about 2.5 minutes. We have quite a lot to cover this afternoon. We have about 4 sessions. I'm gonna be starting with understanding the data, the growth data that we have. Dr. Yemi Kale, I think you want to kick off this session. Can you please provide some understanding of the growth data that we saw in Q1, both in the context of pre-economic conditions before the emergence of COVID-19 and the expectation of a confirmation of economic recession in the coming months, especially given that Nigeria recorded 1.8 growth, but whereas in most other regions it was negative. Can you please just give us a reaction to that and let us understand the data? Thank you.
Okay, I think as everybody already is aware, since 2016, the economy has been trying to recover from that recession, and it had been recovering extremely slowly, and that's where we are. So we are getting gradual improvements in the economy right up to Q1 2020. Now, a lot of people would say that well, the lockdown in Nigeria only started at the beginning of the second quarter, so the growth in Q1 had there was no impact of COVID on the growth in Q1. That's not exactly true, and that's because the Nigerian economy is still tied to the global economy, and many countries that Nigeria depends on, China, for example, India, some countries in Europe, and the US, were already feeling the impacts of COVID, and the implications were a drop in oil demand and in prices of oil. And we know that, I've said this several times, that even though oil has only 10% contribution to GDP, it has about indirectly and directly about 60% implications on the entire Nigerian economy. So we're already seeing the impact of COVID on the Nigerian economy, even though the Nigerian economy had not yet registered many cases and had not even locked down at that time. So what you see in Q1 is a combination of an already struggling economy since 2016 and the early effects of COVID affecting the Nigerian economy, but mostly as a result from outside. Now, what you're going to see in Q2 is now the full-blown impact of COVID, likely as a result of domestic factors. And that's basically what it's going to lead to. I'm fairly certain that Q2 is going to have a very strong negative growth. And as far as are we going to get into recession in Q3 is concerned, which is likely, although I don't think it's inevitable, it will depend on a lot of things that we do between now and then and the third quarter. The previous session with the Honorary Minister of Finance, Budget and National Planning stated things that the government is trying to do. And as long as those things are done pretty quickly, we might be able to avoid negative growth in Q3. And if we avoid negative growth in Q3, and again, it's very unlikely. If we avoid negative growth in Q3, then we'd avoid a technical recession. Although I believe that for the entire 2020, GDP growth in Nigeria would definitely be negative.
Okay, thank you very much. Actually, I want to move very quickly to you. Given the trajectory of the COVID-19 itself, starting in China, I mean, of course, Europe, the US, when do you think the uncertainty and the disruption in supply chains started to provide an element of contagion, especially in relation to Africa?
Yeah. No, thanks. I think it's a fundamental question, right? And the answer is nobody really knows. If you look at where we are today as a continent, we woke up this morning to about 250,000 cases across Africa, right? The top 3 countries, South Africa, Egypt, and Nigeria, accounting for probably half of those cases. Governments, like we heard the Minister of Finance, they have been putting a number of measures in place across the continent. But the challenge we have is that we've had to start reopening our economies before we hit the peak, right? And so across most of our countries, we're tracking sort of countries that are under lockdown. We see fewer and fewer countries under national lockdowns, and maybe some partial lockdowns, some regions. But the reality is we have to reopen our economies, to be able to preserve livelihoods, right? But we're doing that before we hit the peak. Implications are, one is, it will take longer for us to hit the peak just because more people are going out, so more people are going to catch the disease. And we're already starting to see the exponential uptake, right? You can see the exponential uptake in South Africa. You can clearly see it in Egypt. You're starting to see it in Nigeria as well, to be honest, right? So you're starting to see that. And so, so we're going to hit the peak later on, right? And the peak is going to be higher. That's the implication. Now, what does that mean for supply chains? The reality is, the rest of the world is starting to recover to a certain extent. Many of our trading partners, right? They're not there yet, but they're actually starting to recover. But the question is, as we reopen our domestic economies, how much of the international economies will be willing to trade with us when we have not reached our peak yet? I think that's a bit of the challenge we're going to face. We're going to reopen our domestic economies, and to a certain extent, they're going to function in some cases. We'll have to work on the muscle of reopening, closing certain areas, reopening, reclosing, and so as businesses and people are going to have to deal with it. But I think the fundamental question is, how much is the rest of the world going to be really to interact, to fly here, to accept some of our exports, to export products to us when we haven't hit our peak yet. It's not clear yet, and that's something we're going to have to discuss.
Yeah. Oh, thank you very much for the answer. I want to follow up with you on that. What Acha has just explained is in relation to the trajectory. However, underlying that is the behavior of people in Africa. I'm sure you probably listened to the Commissioner for Health this morning explaining why the typical model they are seeing in Lagos is different from the global model we saw in Europe and in the US. Actually talking about underlying conditions. So if you go out on the street in Nigeria today, to majority of people, it appears as if nothing is actually happening. So how does this behavior, especially given what Asha has just explained, and the behavior that you see on the street of Nigeria today, how do you think that will shape the data later in the year?
I think it's going to have a significant impact, particularly because we have a large part of our population that's not very well educated, and large swaths of the North, persons still believe that COVID won't affect them, or it's something that's a disease which doesn't affect everyone. There are certain categories. Some people believe it's a disease that maybe it won't affect Black people to a large extent. And so because of that, even the protections and the social distancing that's required is not really being observed. Face masks are seen more in the cities, but even in the cities, they're not widely used. You find it more in places like Lagos and Abuja, but beyond that, it's not really very common. So for a lot of educated people, they understand the implications of the disease and they are doing their best. However, a large swath of the population that need to go out every day in order to earn their daily bread and find a way to eat, social distancing eliminates some of the businesses in which they need to earn a living, and they're not doing that.
Interesting. Thank you very much. Charles, I want to bring you in and I want you to bring the context, the global context into this. For many of the developed countries, the China, US, Europe, the first quarter was very, very bad. But the expectation is that Q2 will be worse. So how do you think Q2 being worse will shape economic development in a country like Nigeria and other emerging economies?
Again, I have to start with the we don't know, but having done that, I'm personally of the view that it's going to be a little bit more V-shaped than some think. The World Bank has come out with a lot of very negative views for the world economy just in the last few weeks. I think they're doing that faced with the data we do have, which is pretty poor. But we just had some retail sales figures out of America for May, 18% rise month on month, after a smaller than that fall in April. So the Americans stopped shopping in April, but shopped in even bigger numbers than ever in May. So it looks like they are racing back to the shops. And we're hearing the same sort of retail recovery already in the May and June figures, just anecdotally in Europe as well. While China had its worst period in February, and by April, May was already looking considerably better. So I'm hoping that the big stimulus we've seen from the Fed, ECB, from governments are going to make this relatively V-shaped. That then lifts the global economy in the second half. That then gives oil prices a bit of a support, and Nigeria will be looking a little bit healthier before the end of this year, is my hope.
Okay, thank you for that. And I want to go to some nitty-gritty of the data, and this will be my final question on the data aspect. And Dr. Yemi Caleb, given that we are just 2 weeks to the end of this quarter, what do we already know about Nigeria's growth data for Q2? Especially because it requires a kind of understanding. FCT was shut down, Lagos was shut down, Ogun State was shut down, but not many other states were really shut down apart from the restriction on interstate and on the airlines. So can you give us a sense of the growth data that you are seeing in Q2? Maybe in, of course, aviation is out of it, but I'll be particularly interested in agriculture, in telecoms. I mean, are there any of the sectors actually holding up? What should we look out for?
Microphone.
You're on mute.
Sorry about that. I was saying that let me start off by the 3 states that you said were shut down, while many other states weren't. First of all, those 3 states are almost half of the Nigerian economy. Combine Lagos, FCT, and Ogun State. So that's already bad enough. But I want to approach it from the person. And if you look at the 46 economic activities that make up the Nigerian economy, apart from agriculture, the economy is largely driven by services, and the services sector is largely FCT, it's largely Lagos, and that's where everything is. So once you expect a collapse in the services sector, you expect it to happen in Lagos, and you expect it to happen in FCT. Now, the best way to look at what will happen in Q2, and I'm seeing some of the numbers already, like I said, points to a very, 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 very poor second quarter, although I'm not going to state the actual numbers at this point because we are still collecting. Now, if you break down the 46 activities, it's very easy to understand what is likely to happen. I like to do this by focusing first on the 7 economic activities that account for about 70% of GDP. So we start with agriculture. Now, agriculture was affected, but not significantly, because there's restrictions in movement and things of that nature. Farmers cannot go to their farms as quickly as possible. But it's not as significant because agriculture in Nigeria is still rain-fed. You don't need to really have a lot of movement for output. About 90% of agricultural output is still subsistence farming, is still smallholder farms all over the place and so on. So that's unlikely to be significantly affected. Then you go to trade. Trade is the second largest economic activity. Trade is significantly going to be affected, obviously, because you have domestic trade and you have imports. That's what makes up your trade. Your imports were completely more or less stopped in the second quarter, and your domestic trade, which is basically as a result of domestic production, manufacturing and so on, which is largely based in Lagos, for example, was also affected significantly. Then you go to real estate. There's nothing really happening in real estate. There was nothing happening in that quarter. Those are the topic. You go to telecoms. Telecoms actually benefited from the pandemic. It's actually largely as a result of improvement in data. So telecoms actually came out looking good. You go to manufacturing. You've heard what those in manufacturing were saying. We are seeing what the numbers are saying. It was hit significantly as a result of the pandemic in Q2. Then you go to crude production and oil prices. We know exactly what happened as far as that's concerned. Now that is your 70% of the Nigerian economy, which most of them actually having serious challenges, and those that didn't have serious challenges struggling with only one of them, and that's telecoms doing actually well. So you expect significant problems. So you look at the other 30%, hotels and restaurants. That's largely a Lagos FCT thing. You look at accommodation. Sorry, that's the same thing. You look at art, entertainment, recreation, all the shutdown of shows and the movie theaters and so on. They are very small. They have very small contribution to Nigerian, but they are all hit. You look at other services, they are all hit. You look at construction. Again, these are things very small. They contribute very little to Nigerian economy. But what you are saying is that the 46 activities, probably not more than 4 either had a little negative or no effect whatsoever. But the rest of them, meaning 40 or so economic activities, would have significant challenges in Q2. And that's what the numbers are showing. So I'm expecting a very serious, a very difficult Q2. And I think Q1 did better than we had estimated, actually. We are hoping that the performance of Q1 actually might help the overall numbers for 2020, but we expect Q2 to be very, very negative. The figures we are seeing so far is very, very negative. Looking at it from the consumption, from the expenditure approach, household incomes were significantly impacted. When you lock down Lagos, that has the largest micro businesses, for example, micro and small businesses in the country, that is where your consumption is coming from. That's where your population that consumes. We saw the expenditure data, Lagos, the share of Lagos in expenditure. So if Lagos is shut down, if FCT is shut down, you can see the huge impact to have on consumption. Consumption is 70% of your GDP, and consumption was really hit. So in Q2 and maybe in Q3, we're going to have a very poor outing. I am not as confident as Charles is about a V-shape, not for Nigeria anyway, for 2 reasons. One is looking at the economic structure of Nigeria that is tied very significantly to oil prices. And if you look at Prof's argument that he doesn't expect oil prices to shoot up anytime soon, it means there's going to be a serious issue for Nigeria. Looking at oil demand and the OPEC agreements has cut down on all output potential, and with low prices, I don't expect the oil sector to do significantly. And if the oil sector does poorly, we know the impact on the rest of the economy. And the second part is looking at the history of Nigeria with economic recession. We've never really come out of any V-shape. It's always has been slow. Look at the last 3 recessions: slow, gradual, very difficult, and that's because of dysfunctional structure that the Nigerian economy has. I don't see this is even the worst of them all, in my opinion. So I don't see a V-shape for Nigeria. I think it's probably a U-shape with that bottom being very, very, very long. I think that's where we're going to see. In 2016, the recession was not this bad, and already it took so long for us to get out of it. So I think I expect this will be a very long, drawn out recovery.
And that is where I want to actually start the second round of questions. The pre-COVID-19 economic conditions in Nigeria. Of course, had the recession 2016, and between that 2016 and 2020, two things actually happened. One is growth has been less than 3%. In fact, at some point it was just over 1%, 1.8, and the largest growth we had was 2.8 in Q4 2019. So that was the first thing. The second thing was that the economy actually has not reached the levels that it reached before the economic recession of 2016. That level in terms of GDP size, it has not reached that level. So actually, I want to start with you there. How do you think these preconditions, as following up from what Yemi Kale actually said, how do you think these preconditions will actually affect any kind of recovery that we may have?
Yeah. No, I think it's it's a fundamental question. I'm more with Yemi than I am with Charlie, to be honest, right? In terms of, I'm generally an optimist, right? When I look at Africa in general and Nigeria in particular, I think it's going to take some time, right? So we run 9 scenarios around the world, and we run it for different countries, including Nigeria. And we survey 2,000 executives every couple of weeks just to get a sense for which of these scenarios they think is the most likely. The one executive today think is most likely is sort of return to pre-2019 levels more in Q1, Q2 2022, right? That's more the business side, right? So that's roughly where globally, I mean, some countries will get there quicker, some will get there later, but that's roughly where they are. I think the challenge in Nigeria is Nigeria actually facing 3 crises, right? Nigeria is facing the global, and that's in many of African countries. Nigeria is facing the global pandemic, right? So we talked about supply chains. Just to give you a sense, for every dollar of product manufactured in Africa today, we import about 40 cents of inputs, right, across the continent. And a lot of that comes from China, right? So that has been disrupted, it has a massive impact on our exports, as you've seen oil from Nigeria, but whether it's cocoa from Ghana or flowers from Kenya, right, same thing. We then have the African pandemic, and we talked about household expenditure, so that has really impacted, I think first on movement of people. So the tourism sector, business tourism, for example, in Nigeria, impacted, plus, households expenditure, business expenditures, and then oil, right? So oil has had, as we've heard the Minister of Finance say many times, has a massive, massive impact on the economy. So it faces those 3 crises. And I would say in 2016, we only faced 1 crisis in Nigeria, which was the oil crisis, right? And we saw what happened. And so now we're facing 3. So I do think it's going to take much longer. I think the government is putting in place, the right set of measures that we've seen other governments put. Some people could argue, can we do more in certain areas? Can we do less? But I'll say 2 things. One is this, the minister also talked about, don't waste a good crisis. I think it's an opportunity for us to really reflect on what are some of these tough measures, right? We talked about subsidies and those kinds of things. What are the tough measures we're not be willing to take? And just because, we're against the wall now, we have to take them. So what are these tough measures we have to take? But at the end, and I always say that, I've done a lot of work in Nigeria and I love it, but it's all about execution, right? I think that's really where we've really not been able to deliver in many cases, right? So the question for me is, beyond all these measures, we're going to have the right measures and the right plan in place. The question for me is, how do you really execute against that to make it happen in practice?
Yeah. Thank you for that. Charles, I want to give you an opportunity to talk about the shapes of the shape of the economic recession that you actually emphasized. And I want you to come from the global economic context, because I think that is where you were actually talking about the global economic context. And the idea is that we could actually have a U shape, or we can have an L shape. I mean, some people worry that Nigeria will start using the word Gulf, but the point here is that what are the economic developments? I mean, whether from a global perspective or a domestic, I think will actually shape the curve. I mean, in whether it's going to be L shape, V shape, or a U shape. What are those developments that you think will determine that?
I think from our perspective, we're going to be focusing on services. As Yemi was saying, it's been a service-led recession. We've never seen one quite like this before. It will be retail sales, which is why I was quite excited by those US figures out just this afternoon. And where that's picking up, then we can get some degree of confidence. It's clearly not going to be very V-shaped in certain sectors, like aviation. That's going to be problematic. It's much easier to imagine internal flights within Europe, or flights from Europe, say, to Mauritius, which has cancelled out the virus, which has crushed it, then it's going to see into other international travel. So we'll be paying attention to retail sales, also paying attention a bit to the oil price as a leading indicator for actually what's going on with the world economy. We'd love to think that there was something else which was the lead indicator for the world economy, but it tends to be oil. So that's what I'll be looking for, and I'll be watching out for this second wave worry of the virus. So that's certainly a threat in America. In fact, it's not even a second wave; it is a first wave that they never controlled, and I'm a bit concerned about South Asia as well. I think the numbers in India, Pakistan, and Bangladesh could be huge, way in excess of anything we've seen anywhere else. And that, I think, comes from the challenge of trying to do lockdown or not be able to afford lockdown in very low-income countries. So it's hard to see how that's going to play out. It may be that people just can cope with the virus, like countries like Sweden and Belarus already have shown that they can. But to answer your first question, I'll be paying attention to retail sales.
Okay, thank you very much. I mean, you mentioned three important parameters there, or let me say variables. I mean, the oil price, the retail sales, and of course, the trajectory of the infections itself. Before I come back to Yemi Kale, and after that, Sutra, our audience, I would just like to remind you, please go to Slido and ask our panel the questions that you have. And that is hashtag BD ANC 2020. Dr. Yemi, you started discussion around the past recessions and looking at the 1987, the 2016 recession. And of course, even though we didn't experience recession in 2009 and 2008 and 2009, but there was a global economic crisis. Do you think there are enough lessons in these recessions to help us in this recovery?
I think every recession that Nigeria has faced, every challenge Nigeria has faced has always had significant lessons for us to learn. The difference is that we never take advantage of them. We never have. We get upset, we start trying to, and unfortunately for Nigeria, we kind of get out of it, or looks as if we are getting out of it, and just because of that, we go back to our bad behaviors of the past. So I've never been one that has been an advocate of recessions ending very quickly for Nigeria, because that creates a situation where we misbehave and don't complete what we are meant to do. So there are lots of lessons that we have learned. There are lots of opportunities that we have to take advantage of, some of which we are doing. There is our reserves, for example, are dangerously low. And this is another reason why I feel that V shape might not work, because at the end of the day, imported inputs, like Ms. Awushika says, about 40–50% of manufacturing companies, for example. So that means there's a huge jump in their cost of production. And your GDP, you have to remember, is both output, which is focused on the consumer, as well as intermediate cost, which is the cost of production of the businesses. So already the dollar has been adjusted at 3.6. That's an automatic increase in costs of producers. So again, you're squeezing local production. I think the difference between Nigeria and other countries is the fact that the palliatives that some of these countries introduced was to keep consumers spending. So there was direct cash into their hands to keep jobs from dropping as much as possible, though millions of jobs were lost. But despite the fact that millions of jobs were lost, people were still getting unemployment benefits. So that retail consumption spending that Charlie is talking about can work in those countries almost immediately because they have cash. In the case of Nigeria, there's no cash. People lost their jobs or got their salaries reduced, so they don't lose their jobs. So even when the economy opens up and so on, nobody has cash. Millions of people have lost their jobs already. They're not going to get any income from that. It's going to be very hard for them to get more jobs and so on. So the lessons we are learning is pay attention to your consumers, because as far as Nigeria is concerned, as far as most countries in the world are concerned, the consumer is the one that keeps the economy going. And anything you do that affects the ability of that consumer to spend, you're going to hit your economy very hard. People don't produce for the sake of producing. They produce because they can sell to consumers. So no matter how much you support manufacturers, if manufacturers do not have people to buy their product, they're not going to produce. So we keep focusing on the manufacturers, the producers, and we keep forgetting that the consumers, the households, have to have income to be able to buy these goods and services from the producers of those goods and services. So I believe when your economy is 70%, focus your measures to those to that 70% that holds your economy up.
Wow, thank you very much. Sutura, I want to come to you here, especially given your role as an advisor to the government on public-private partnership. There's something that is very, very clear in the last 5 years, and it is that the federal government has borrowed extensively. And if you ask, oh, why are you borrowing this? And they tell you to expand Nigeria's infrastructure. But given the debt growth and the weak economic growth that we've seen in the last 5 years, in hindsight, do you see this as an optimal strategy? And how should we now undo such situation going forward? I think you're muted. Yeah.
Well, post-COVID, it's definitely not an optimal strategy. I think countries all over the world are experiencing financial problems from the pandemic, and Nigeria is no different. Nigeria is in a very difficult financial situation, and ignoring the private sector's ability to partner and provide infrastructure and its attendant services is one that will delay any recovery from any recession. It is pertinent for government to try to find a way to work with private sector, to bring private sector in locally and internationally, to be able to provide some of the infrastructure that we need in order for the economy to grow. It's okay to borrow, but if we're borrowing and that borrowing is not going to productive sectors, if part of that borrowing is only going to recurrent expenditure, how do we pay some of that money back? The government can play a critical role in enabling multi-sectoral partnerships post-COVID. And it is in a very good position now to be able to send a clear signal to investors. Because for a very long time, investors have had a very uncertain message when it comes to PPPs in Nigeria. For example, if you take foreign direct investment, in 2018, Ghana overtook Nigeria. FDI dropped by 36%, according to UNCTAD. In Nigeria, we only got in about 2.2 billion, while at the same period in 2018, Ghana was able to bring in about 3.3 billion. So it's really important for the country to be able to have post-COVID a very clear pipeline of critical transformational investable projects that investors can look at and see that this is a set of projects that the government has coalesced around, transformational projects, and what the UN now calls people first projects, because the gap between the rich and the poor in this pandemic is only going to get bigger. It was already big, but with the pandemic, more poor people are suffering than the rich people. And so whatever infrastructure that you direct your stimulus towards, if that infrastructure does not take into consideration people first, then the impact that you're looking for will not be as large as you need it to be.
Yeah, thank you for that. And one thing that is becoming very, very clear from the conversations before now is that fiscal policies are very, very important. So let me remind you, and of course, the Honorable Minister for Finance also mentioned these two things. But let me remind you, the federal government, they said that they have removed the subsidy. That was the first thing they said. And the Honorable Minister also said that the fall in oil prices actually made that possible, meaning it made it easy for them to remove the subsidy. The second thing that they have entered is a rationalization of government, making the government leaner. However, I mean, I'm sure many people that have followed Nigeria history will understand where I'm coming from. In 2016 as well, there was the removal of subsidy until oil prices actually went up. And also in that same year, there was also a mention of rationalization of government. So, Acha, there was this statement you have made in the past, and you have also mentioned it here, but I really want you to expand on that. I mean, why is the execution of fiscal policies for long-term prosperity and development of Nigeria, why is it just so difficult?
I mean, I think execution in general is difficult. I don't think it's a Nigeria-specific thing, right? I think it's generally difficult. I think in all the work we do in public sector, especially around the world, but or across the continent, it's even more difficult, right? And there are a number of reasons. One is just the monitoring. So it's easy to say, okay, yes, we're going to cut costs, right? And we're going to, reduce expenditures, and we're going to do these. But how was the process to actually monitor this, right, on a regular basis, right? So they put a plan together, and we've done many of these, right, put a plan. But the first thing is then how do we monitor it? What is the team that's going to monitor it? How empowered are they to monitor it? How, who then monitors it, right? And who monitors on a regular basis to say, okay, we had said we're going to take out, 100 billion naira of cost. Where are we today? How much have we taken out? We're only at 60. What's it going to take to get to 100? Yeah, in some cases we overestimated here. Okay, fine. How do we compensate? So all of those conversations, I think that's one. Two is just we call it typical steering committee, the group of people who will oversee this, right? I think in many cases what we've seen is, we have these, pronouncements, we're going to do this, but then you divulge it down to the MDAs to do it. But then, what we lack is the oversight at the most senior level, right? To really say, okay, let me sit down every month, right? And see where we are, what needs to happen, and then see that through. The third thing, and that's always very difficult, what happens in private sector. In private sector, if you don't deliver, the consequences, right? That's quite hard in the public sector, as you can imagine, consequence management. But what are other ways to make sure if somebody doesn't deliver, right? The consequences attached to that, right? Do you get somebody else to come and oversee it? Do you move them to the side? Do you send them to do something else? So I think there are a number of ways, and some governments have done it quite successfully, right? We have a number of governments, everybody raised about, what Rwanda, for example, does, what an Ethiopia does. I think the lessons learned we can learn from what Malaysia has done. I know, the Malaysians also were helping the government in Nigeria in the past, right? So I think it's not rocket science, but I think it's really a commitment and willingness to say we're going to execute things. We have a plan now, which is great, but we're going to execute very differently on this plan to make sure it happens, right? And learning a lot of the lessons from the private sector.
Yeah, thank you for that. And also staying on fiscal policy, I will come back to Yemi Kale shortly, but I want to ask Charles on this. The United Nations UNCTAD, that's the Conference on Trade and Development, following up on what Secretary actually said. They said the global economy, is on track. FDI is on track to decline about 40%. Given that Nigeria was not even able to attract much in the last 5 years, and given where you sit, amongst the investors, some of them in Nigeria, what is even our chance, given the fiscal policies that we're not making so much progress, given the global economic context, given the competition we have for FDI, what is even our chance of even getting the lead to from FDI, and what is investor sentiment concerning Nigeria at this time?
Well, that's a tough question because the answer is pretty tough, which is the sentiment is pretty negative. The best V-shaped recovery we ever saw in emerging markets was probably 97, 98, the Asian crisis. And they all devalued their currencies. Within a year, all of their electronic production, their manufacturing suddenly became so much more competitive in the world economy, and they did really, really well. To many people's surprise, people thought the whole kind of capitalist model of Asia was a little bit messy. There was a little bit too much connection to the government, but nonetheless, they rebounded very well. The difficulty for Nigeria in capturing the rebound, well, firstly, oil. The long-term oil price over the last 25 years has averaged about $63. We don't think it's going to get back to $63 next year. I mean, no one really knows, but our base guess is about $50 now. So you're going to be under the long-term average. And the second thing that would be great to see would obviously be some sort of manufacturing renaissance. But, I've done a lot of work on this, and I've been trying to work out what countries have got right when they've industrialized. It's been education first, and Nigeria is getting there, but hasn't hit this 70% metric of adult literacy, which seems to be, for 200 years now, the essential level you need before you can industrialize. Then you need electricity. And everyone in Nigeria, not just Nigeria, South Africa would say they have an issue too, but everyone knows that there's issues about the supply and the regularity of electricity. Ghana's got 3 times as much electricity per person as Nigeria. Their adult literacy is nearly 80% versus Nigeria's 60-65. So the factories and the foreign investors are more likely to put their investment into a Ghana, and which is exactly the point made by Satura before, than Nigeria. And in the short term, that's not easy to change. The government needs to get education right, needs to get electricity right. And if it gets those right, then it can get investment right. And the exchange rate sits there as this big cloud, which constantly comes over and rains on Nigeria every few years, it seems, at the moment. And that's another difficulty for foreign investors. But we can touch on that more. I'm sure you'll come to that before the end of the session.
Yeah, thank you very much. And we are we're nearing the end of the session. And before I come to 1 or 2 questions that I have here, Sutura, I want to ask, given your engagement with government, because that is what NIAB does. NIAB does not execute anything, but NIAB does engage the government. Do you really think, that the government will pursue any fundamental economic reform following COVID-19? The serious reforms that we've all known about for, 5, 10, 15 years. Do you foresee any of that happening?
I am an optimist, and I feel that the economic pandemic, the COVID pandemic, is something that none of us have ever seen before. And I think if there was ever a will to make any changes or to push through the reforms that we need to push through, this is the time. And if you look at what's happening with insecurity around certain parts of the country, already the signs of what will happen if the change doesn't come is already evident. And I think that the government of the day is aware of what's going on. And from the engagement that we're having with government, they are doing a lot of things to try to address what's going on, particularly in the short term post-COVID. And then with the longer plan for the economic sustainability going up to 12 months. So I really do believe that this is an opportunity that the government will take to make some real change.
Okay, thank you. I have one question here from one of our participants. He said, has Nigeria grown its capabilities in ensuring optimal utilization of external debts, such that return on investment purely from debts could pay our debts? I don't know who wants to give that a try. After answering that question, we're going to take our closing remarks. I don't want to ask SG that question, so let me ask Hacha.
I thought you would ask Charlie. So the answer is I don't know. If you look at Nigeria, right? We clearly we've had a revenue problem. We always talked about tax revenue for a while, but we've had a revenue problem, right? And the big question, even pre-COVID, was how do you really significantly accelerate revenue generation for the country, right? So I think that's part of it. In a context where across Africa, revenue to Africa general revenue to GDP is about 19%, and then we take 22% of that revenue and we pay off debt, right? So so we've had a general revenue problem, 19% to GDP in Africa. In Nigeria, it's worse than that, right? So I think the first thing is, if you want to pay off that debt, how do you generate the capacity to pay off that debt, right? So I think, so I think there's, again, a big focus on trying to figure out, but in this depressed economy, how do you generate increased revenue, from taxes where country government companies are struggling? It's not going to be easy, right? Non-tax revenue on the oil front is going to be difficult as well, right? So, as much as, we have that lever, that may be challenging. So you say, what else can you do? It's about reducing cost, right? So now we have all the plans in place to reduce it. How do you make sure that actually happens? That when you say you fundamentally reduce your cost base, that's back to my focus on execution, to make sure we say we're going to take out this much of cost out of government costs. Let's make sure we do that, right? And then over time, we're not going to be in this situation forever, right? So really starting to think through reimagining, what could Africa look like going forward? What could it look like for Nigeria going forward? What are new opportunities that emerge for the country, right? To again, drive this revenue. So I think, it's not going to be easy in the short term. I think that's what as you were saying, it's not going to be easy in the short term, but it's going to be that's why it's even more focused on us making sure we deliver on, the cost containment measures, and then making sure over time we start to really look for new avenues to generate more revenue.
Okay, so as we are definitely coming to the end of this session, so I want to ask all my my esteemed panelists one simple question, the same question for you all. And this panel is about answering, how deep and how long do we think the recession will be? And I understand all that has been said in terms of the dynamics that will shape this. So let me ask this, putting all those together, I want to ask you two questions in one. In your best estimate, one, when do you think Nigeria will come out of recession? But I think that is not as important as if we do not see strong growth in the next 2-3 years, given what you have said, actually, given what Yemi has said, and of course, even the pessimism expressed by Sutura and Charles, what do you guys think will happen to poverty, inequality, jobs, security? Because you see, these are economic discussions, but the social impact is even worse when we don't have strong economic growth. Because if we do not have that strong economic growth in the next 3 years, it means that for almost a decade, we may not return to the size of GDP we saw in 2015. And given all the birth rate, and all the challenges of the country, what does this mean for Nigeria? So as you sum up, please, could you please just answer those two questions in one? What is your best estimate regarding recession? And what does happen, given the economic crisis, to jobs, inequality, insecurity, and of course, poverty? Sutura, you can go first. 1.5 minutes, please. Very quickly.
Okay. I think the best estimate for the recession, it's like what the SG said, it will be a long one, particularly because our institutions are weak and their ability to respond quickly might take a little bit longer. In terms of the impact on poverty, jobs, and on the poor, I think if we do not seize this moment, the security challenges are going to population in this country. And if we do not find a way to mitigate the impact of COVID on this large, young population, the security implications will be significant. Thank you.
Interesting. Charles.
Yeah, look, I'm going to say the same thing that I said in 2015-16. If you keep a currency steady when your main export crashes, then yes, it's a shallower hit to the economy at first, but it takes a much longer time to recover. if you have currency flexibility, you can have more of a V-shaped story. So the Russian ruble, I was just checking, dropped 35% in 2 months and is now rallied back 16% because the currency becomes the safety valve and enables you to get back to quicker growth. And if you don't get decent growth in Nigeria, then I do wonder whether people are going to say, people who are worse off per capita since 2015 now, are they going to end up saying the whole structure of this is wrong? And we saw that sort of challenge from the communism in Europe in the early 19th century, when there was massive numbers of young people and commodity-driven economies like Russia were saying, we're not getting enough benefit from this story. And you ended up with revolution. So I would like to see Nigeria getting better quicker. That would be ideal.
Yeah, thank you very much. Archer.
Yeah, I think very aligned with what Stuart and Charlie said. I mean, at the end of the day, I was actually reflecting, the SG can tell us, I don't think since the recession, Nigeria has grown faster than population growth. I think population growth is maybe 2.5% or so, right? And so we're talking about, I'm very clear, Nigeria is most likely going to go into recession this year, unfortunately, just like the whole continent, by the way, for the first time in 25 years. Yes, we can focus on when are we going to come out of recession, right? Hopefully, we'll technically come out of recession, hopefully next year sometime. But the key question for me is how do we really get to decent growth, right? How do we get to 6, 7, 8% growth, which is what people say we need double digits. I like it, but how do we even get to 6, 7, 8% growth, which is, then you start to say, per capita GDP is starting to grow. You're starting to get, children who are not ending up being poorer than the parents, right? And so that's what we need to. And, and I think we struggled for many, many years now to get there, right? And I think to what Satura and Charlie say, if we don't get there, all these risks around, yes, you'll get a lot more poor people, you'll get a lot less educated people, has a much more fundamental issue long-term on the economy. But there's a security issue, right, which we really need to realize is real, right? And so for all these reasons, I think the focus in my mind should be, yes, how do we, recover and get our recession, but the bigger focus should be how do we get to I'd call it 6, 7, 8% growth, if not double digits.
So thank you very much. So Yemi Kale, so let me ask you, since you are the SG, when are you going to give us strong growth? When are you going to give us strong growth data? We need some.
To determine when strong growth is given, I can only report whatever growth is happening in the economy. But I think I agree with, I would say that coming out of recession, which I think is a lot less important, probably early next year. And that's probably because of the base effect of 2020. Yeah. It was so bad. And coming out of recession just means positive growth. I think the impact of the risk of the recession is going to be much longer. And that we barely recovered from the impact of the 2016 one. So coming out of recession early 2021, but the impact is going to last a bit longer. And of course, we understand the implications for employment and poverty is straightforward. The economy grows. If the economy is growing, it means that people are demanding more, and it means that production has to go up, and means businesses are hiring more people. The more people they hire, more jobs means they also are coming out of poverty, and so that's actually a lot more straightforward. I have to emphasize something based on the last poverty study. Yes, 40% of Nigerians were in poverty, but you see another 20-25% that were just above the poverty line. So that tells you, look, the slightest shock push everybody back into poverty. So that's the part where I'm more worried about. That yes, people were just above, but there's still a huge 20% that were just above the poverty line, and you can see the implications of having the economy growing strongly. All you did was shut down. I use Lagos for example for a few weeks, and what people were saying is, "I can no longer feed." That's another way of looking at a long-term recession. If you prevent people from having the ability to, this was government policy by shutting down the economy. But I'm saying it's the same impact. If the benefits of the economic strong growth is not coming out, you're going to have that same, I'm going to work, fine, but I'm still unable to feed. And that reaction that we saw in Lagos is going to be exactly the same thing that's going to happen for a long-term negative impact of a recession in Nigeria. I think that's what we are more worried and more concerned about as far as security is concerned.
I thank you all. Given that we have come to the end of this very exciting session, and I want to thank the panel that has graciously accepted to speak. Archaleke, Charles Robertson, Suture, and of course, Yemi Kale, the Statistician General. Thank you all. Let me just also say at this point, close the session for today. I'd like to thank before the first session, the second, the third, and of course of this session, we thank you all. And of course, the participants and our audience that have joined us from within Nigeria and outside Nigeria, we thank you all. This is a 2-day event. On to the end of the first day. The second day comes up tomorrow and it starts by 11 a.m. And today we've looked mostly at macro issues. Tomorrow we are looking at energy, education, and of course, looking at an exciting session, looking at the past success story in Nigeria in terms of policies and what we can replicate this time. So at this point, I would like to hand over to Tayo Fabule, who is going to wrap up what's happened to the polls, the questions on the polls that we did. So thank you all. Thank you, Hata. Thank you, Charles. Thank you, Sutura, and thank you, Yemi Kale, for joining me this afternoon. It's an interesting discussion, and of course, I'll see you all another time. Thank you. God bless you.
Thank you very much, Dr. Okiti, and thank you to our distinguished panelists, not just those who have just spoken now, but those who spoke earlier in the day, and also thank you to our participants who have held on with us throughout the day. It's been an interesting day, and for each panel, we've tried to hold a poll to fill the polls of what the participants have to say. So the show is not just for the panelists, but also for the participants. So when we asked our participants about the first session, which was on the response of the government so far to the COVID, especially from the healthcare perspective, we asked, did the lockdown curb the spread? I think most of our participants said yes. 63% of them said it was effective. Do they think that the COVID-19 numbers in Nigeria reflect reality? No, is the answer. And it's an outright no. At least 88% do not doubt the numbers that are being reported daily. Do they think medical professionals are equipped, protected to handle the pandemic? 86% think they are not. And so basically giving feedback on what more needs to be done to protect those in the front line. Are they satisfied with the response of Nigeria so far? Again, about 61% do not think that is being done properly. At least 71% actually are not confident that enough is being done. Are they confident, positive about Nigeria post-COVID? We've had a lot of optimism despite the challenges. And it seems that optimism is also viral, like a virus itself. And they are positive about Nigeria. 72% are positive about Nigeria post-COVID. For our second panel, where we were discussing the governance and optimizing Nigeria's response, we asked our participants, do you think the virus exposed failure of governance in Nigeria? 95% of them think so. We asked if they thought that which of the sectors was most affected, and they think the economy, because the two options, was it health or economy? And most said it was the economy that has been most affected by the outbreak. Do they believe the present government structure is to blame for this response and the impact on the economy? 72% of them say yes, that the present governance structure isn't working to respond properly to the pandemic. What sector should government focus on? Education, health, small businesses, or economic relief? A good chunk of our respondents said, 27% of them actually, because it was a tie between health and economic relief, and we have most saying 27% saying education should be the focus. For our third panel, which was on mapping Nigeria's response, that's its physical response and strategy to the pandemic, we asked, do you support the immediate removal of fuel subsidy, which has been one of the new narratives that the pandemic has been able to make possible, and that thought of removing the subsidy. And 82% of them say yes, they want the subsidy removed. We also asked our participants, do you think the federal government is overborrowing? Another topical issue today during the discussions. And yes, 91% think the government is overborrowing. Are they satisfied with Nigeria's fiscal response to COVID-19? No, 77% of them think the response hasn't been effective. Are they also satisfied with Nigeria's fiscal response? Okay, so I've taken that already. They are not happy with the fiscal response. Do they think the government will downsize? Another new narrative that we're talking about, bold reforms that the pandemic is bringing to the table. Many of our participants, 69% of them, think government won't downsize its ministries, agencies, and departments. Should the government borrow or boost export its way out of the recession? Most of people that participated, 95% of them think it's better to export our way out of the recession rather than borrow, which was most of the things that were being discussed in our last panel today about the economy. Do they think the recession will be worse than that of 2016? And see if they're all on the same wavelength with the last panel today. They all say yes. 88% think that this recession that we have entered will be worse than that of 2016. Are they satisfied with Nigeria's monetary response to COVID-19? About 72% of them are unhappy with the response of the monetary response to COVID-19, and 66% of them are confident that a devaluation of the currency of the naira will help the economy rebound, which is one of the things that came up today as well. I would like to thank all of you who have been listening, and I pray and hope you'll join us tomorrow starting at 11 a.m. Thank you, and do have a good day, and please do stay safe.
Hedel's COVID-19 Checker is an easy tool to use. Just enter the link hedel.medictor.com into your web browser and click OK. Then it takes you to the page Test COVID-19. You click and it takes you to another page that requests your gender. Pick a gender and you go to another page where you specify your age. After specifying age, it takes you to the main page where you enter your symptoms. You can see feeling of fever or cough, and you can pick more than one symptom. It further dives down and asks you which of the following symptoms you think is the most prominent, followed by a few other questions to ascertain diagnosis. Hedel's Symptom Checker then asks you to indicate your risk of exposure to the coronavirus. You can pick more than one option and click Enter. This is the result page. It says it appears you may have a high risk of COVID-19 infection. So you just scroll down and take the short questionnaire asking you if you're satisfied with the result. Click yes or no. Now, let's run through the results page one more time. The recommended action, click on it, and it shows you the numbers you can call in whatever country you are. For Nigeria, it shows you for NCDC and Lagos. There are numbers also for Ghana, Kenya, South Africa, and Tanzania. One very important feature, Hedel allows you to download the reports in PDF format on your mobile so you can send to your doctor or physician through WhatsApp or any of the social media applications or by email.
The tastiest blue band with vitamins A, D, E, B6, B12, folic acid, and niacin. So important for kids' growth and development.
You can tell they're from a blue band home.